Okay, and good morning, everyone. Here I am. I'm hiding over here. Do I look washed out? Does my color look good? No. Okay.
Kind of.
It's a little glary. I mean, it would have been nice to make it look better. Anyway, good morning, everyone. All right, real quickly, we're going through our comments. I'm your host, Joe Basha. Everybody who's watches the program has heard enough about me. Moving on, you can contact us at perfusioneducation.com. Look at the bottom of your screen down there, and you see the little scroll bar going along. You can always find us there. Please like us, follow us, share us, do all that kind of stuff. Whatever you do on the various different social media platforms that we're on, it's really appreciated. It's helping us a great deal. I tell people this jokingly now all the time that we are finally now being monetized by YouTube, believe it or not. We got our first disbursement of $1.47. I was just so thrilled. It was amazing. Okay, amazing. But they're putting ads on our thing now, so I'm kind of excited about that. Okay, it's a big step. Okay, up to 5 years, $1.47. It's really. I mean, I could see a future, perhaps. There's that. Our MediWeb app. If you don't have it, get it. Google Play Store or the Apple. The Apple Store, whatever you call it. And then last is our podcast, whatever your favorite podcast streaming software is. You can go on there and listen to us, and hopefully it'll be entertaining. Okay, now I need to tell you who some folks are here, all right? Standing next to me is our intern, Maddie Fontenot. And Maddie, hello, welcome. You've been here now a couple of weeks. You think that we're crazy for doing this at 5 o'clock in the morning?
I do, yeah.
Yeah, that's very good. Good. So you're excited about a future in perfusion?
Yes, I am.
Very much so. And Maddie's from California and knows me through somebody else we had never met, but somebody that I knew many years ago, like in the 80s, was the niece in medical school of a surgeon I worked with. She sort of followed me around. And then she calls me out of the blue, I don't know how long ago, a couple of months ago, and we originally tried to get you into observing in
San Diego.
Yeah. Right, and that just didn't work out for whatever reason. So we developed an intern program here, and here she is. And hopefully by the time you've finished with us, you're doing everything, right? You're learning how to do everything from setting the pump up, tearing it down, priming it, all the lab stuff. So it's a real internship. NRP, you're getting involved in that. You got to scrub on a case at one point in time. So you're seeing a lot, and we're really, really hopeful that will give you an edge as you go through the interview process with Perfusion School.
Yeah, I'm definitely getting the crash course. I'm learning a lot every day.
And enjoying it, I hope.
Yeah, for sure.
Very good.
Absolutely.
And everybody that's with us, I think, has welcomed you very much. And I think that you've done a great job, too. So compliment yourself, because you've integrated in very well. You have great personality, and I think the kind of person we need in this industry.
Thank you. I appreciate that.
Perfect. So now let's go down the list over here on the far, what would be my right, if you're facing the screen, left on the screen, is Lindsay Roberts. And Lindsay is a recent graduate of the UT Perfusion School at Memorial Hermann in the Texas Medical Center. Mm-hmm. And she started her career with us as an auto transfusionist, moved into the perfusion assistant program, got accepted into perfusion school, did exceptional in that program, and here she is today working for us as a perfusionist and is here to show us, teach us all something, because you're the new one, and I've looked through some of these questions, and I have to be honest with you, they didn't have questions this hard when I went to perfusion school. I don't think I would pass this test. This does not look like an easy test. And then, I'm serious. I mean, the ones we had were just, I mean, they were really, I mean, it was very basic. It was only like 10 questions. No, I'm just kidding. It was a little longer than that. A little longer. Then there's Vivian Moreno sitting next to her. Vivian actually is from out here. I learned about Vivian from a nurse that I used to work with, Karina. I don't remember Karina's last name.
Church,
but I think that was her maiden name.
Yes.
She's married now, so it's something else. But Karina, she was working at, of all hospitals, Tomball and Regional, which is a very, it's a smaller hospital, kind of does not a whole lot of hearts or anything like that. Not a big heart program, but they do hearts. And she's like, yeah, I know this girl. And you were just finishing school. You know, you had
Almost,
just
yeah.
graduated, but you were thinking about moving back here.
Yes, I
And-
still had a semester left.
You had a semester left,
Yeah.
that's right. And you ended up choosing to stay, much to my disappointment, at Columbia Presbyterian, where you went to perfusion school, right?
I went to perfusion school at Hofstra, but I rotated at Columbia.
Right, they're close though, right? Hofstra, and aren't they pretty close to each other? They're in the same area, northeast, right?
Columbia's in Washington Heights, and Hofstra was out in Long Island.
Oh, that's cool.
Both in New York.
Yes.
Okay, that's my
Yeah.
point. They're both in the same place, but she decided to stay there and then called me out of the blue and said, "Hey, are you still hiring?" We weren't, but I was like, "Absolutely, absolutely." So we're so happy you're here.
Thank you.
And
Happy to be here.
welcome us too. Have you talked to Karina yet?
I have, yeah.
Have you seen her yet?
Not yet.
Oh,
We're-
you need to do that.
we
We should have
will.
invited her to this today. And then there's Mindy. Mindy Navarrete. She fancies herself as a pickleball expert. Now, she's been in perfusion a little longer, just a teeny little bit longer than Lindsay. Not by much, just a little, maybe a day or two, something like that. But she came from Virginia. Her and her husband, Juan, were good friends with our manager here, Becky Bolkovac. You've seen her on the program before. And Becky actually recruited both Mindy and Juan to come here, and they came just at the right time. It was really needed at the time. Both of you have done exceptional. Mindy's an exceptional perfusionist. She does a really good job, and very well liked, very well respected. But we do have some nicknames for her, but I'm going to leave those off the list today. For today. And for Joanne, too. Her husband, Juan, Joanne, yes, we have some for her. And then there's Melissa. Melissa was up in Dallas working. She was living her best life. And I showed up with Tammy, who used to be the manager here. We flew up there. That's what got you to come. No one's ever flown up here, flown somewhere themselves in their own plane to interview me. And that's how we ended up getting her. And you've been here now for 4 years.
Yeah,
three.
three. It'll be three this July.
Yeah, man, I'll tell you what. And you've since you got here, you even had a child. I think you got pregnant here.
Mm-hmm.
Yeah. So the job, clearly, it's a good job. You see, it's not. There's obviously time. Clearly, okay. And but it's been great having you too, Melissa. It's been fantastic. And so I think I've introduced everybody. Now I need to explain this game. So if we go up here to the desk, and you can come with me, Maddie. Here is our patient. Let me see how I can do this and not be in the shot. Here, let me come over here. So here is our patient, okay? And here are the sticks, all right? And I actually learned of this game from someone else, but we won't have to get into that now. But it was a really smart idea, I thought. And this thing you could buy, it comes from China. So it takes a while to get. They sent it apparently on a really slow boat. But I finally I ordered 2 because one was like seemingly being delayed in customs. I mean, what would you think would be in this? But it still got delayed in customs. So we're going to ask questions, and these are actual ABCP verified board questions. So there's no question about what the questions are. And they have their own eraser pads, and they'll answer the question, hold it up, and we'll keep score. If you get the question wrong, then Maddie will roll the dice, and you'll see the dice over there. And you'll see it as she removes the cup from it, so you'll know exactly what the number is. And then you have to push these sticks in. You don't have to push just one. You can push as many sticks as you want. So let's say you're first and you get 6. Well, don't push one in 6 times. You can push 1, 2, 3, 4, 5, 6. So you can sort of strategize as the game goes on, but only those who get it wrong. Now, if 2 people get it wrong, then it has to be rolled twice, and both have to do that, okay? Until the patient is killed. When it explodes, they are no longer. There's no ECMO anymore, okay? They're on ECMO now. They're either going to get decannulated or they're going to decannulate themselves. Something is going to happen. And at that point, whoever was the one who made it explode gets a point. There's 3 rounds, round 1, 2, and 3. Round 1, each explosion is 1 point. Round 2, each explosion is 5 points, and the third round, they're 10 points. But the last one is 50. So, and that'll be the final one, like Final Jeopardy, which basically means you could not be doing well, but one person goes over the top. So that last question is going to be really worth a lot, unless you just get every one wrong, and in which case it's going to be really hard for you, but you still could, okay? And there really are no winners or losers. It's just fun, okay? And we'll see. I'm just glad I'm not doing it because I don't have enough balloons or gloves, okay? Because it'd be pop, 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 pop. All right, so everybody understands the rules. And you guys can just hand it down to whoever needs to do it. If you need to express displeasure, you have the goat. You can always use that. And let's have fun. And you have your marker pens.
Yes.
Everybody's got their marker. And this is for cleaning your erase pads. All right, let's get started. Is everybody ready?
Yes.
All right. So, anybody online have any suggestions before I get started here? And let's just take a look and see what we have going on. And I need to make sure that all of this stuff is closed. Close that. So only thing open will be this and this. Okay. And here's the, oh, so is that the question? That's the first one. All right. So we're going to ask the question, and then Magic will post the question up so you'll be able to read it.
I cannot.
What? YouTube. Yeah, on the chat on YouTube.
But I don't have it.
What do you mean you don't have the chat on YouTube?
Oh, yeah, I'm sorry.
That's okay. Okay, so let's go ahead and do the first one, all right? Question 1 is, in the 1930s, who developed the first sterile pulsatile perfusion system, such as the first blood pump that was sterile? Was it, you got it, Magic? Yes. Yes. You have it. Okay, you have the question. So, no, not the, well, you have to have the question first, but it was up above. So I'll put the question. So there's the question. See if it works. Trial and error. There, okay. Was it A, and then what you would do is you would come over here and you'll just do that. Just don't do the answer. Okay, there's your question, and that's how you do that. And then hit enter, and then he can put that. Can you put both chats at the same time? Can you put the question and the answer, the possible answer simultaneously? That's fine, they see that. Okay, so put the question, then put the possible answers. Was it A, Carol and Lindbergh, Castellanos and Robb, Henry and Juvelet, Gibbon, or DeWall? So it's A, B, C, or D, or E.
Oh, my goodness.
Okay, so you can get the next one ready. Copy. And C.
I have no idea.
Put it Command V and hit enter, and then he can put that up. And then while we're doing that, you can on this side
bell.
get the answers.
I'm just gonna write a letter.
And C. Don't hit enter yet, though.
Is this
Yeah.
something they teach you
Let
in
him
school?
post that one and then
I
do
think
it.
like the first
Okay,
couple of
time's
weeks,
up.
we
We
covered
need
it
answers.
briefly.
I told you, don't make it a sport.
Oh, they all said D. You said D too?
Oh, great.
See, I told you not to do that. The correct answer is A.
Oh.
Carell and Lindbergh, Charles Lindbergh. Okay,
Thought he was
so
a
once they
plain
do that,
die.
all right, so now, Maddie, you get
Oh,
the
no.
die, shake it up good, right smack in the middle. 4, the number is 4, so we're gonna start far left. You get to put, you can put 4 times, you can put
gonna do that.
4 individual, whatever you want to do.
Is it just one click?
Yeah.
There we go.
Okay.
There's my 4.
See, this is why
All of
don't. Yeah, oh, y'all got it wrong. Everybody got it wrong.
I almost said that answer, the right answer too.
I did too. Ooh. There we go.
Okay.
Yeah, click. I think that clicked. One more. Okay. You go.
Boom! Good. Okay, nobody blew that one up.
Okay.
All right, so go ahead and wait till we post it. Okay,
There's-
magic. Next one. The next one. A patient has a pH of 7.28, a PCO2 of 41, and a bicarb of 17. This patient most likely has, then we'll hit enter, A, respiratory depression, B, hyperventilation, C, renal failure, D, sodium bicarbonate overdose. And everybody gets 30 seconds to answer. So I have my watch
Well,
going.
it's metabolic. So
There's the
would that be just renal
Yeah,
failure?
that's what I thought.
I'm
Yeah.
gonna say the C.
A patient, pH 7.28, PCO2 41, bicarb 17, respiratory depression, hyperventilation, renal failure, sodium bicarbonate overdose. Now this is going to be the best answer, right? Because you know how the board exam is done, okay? It's always like, that's a stupid question, but it's the best answer, or the answers are weird, okay? So what do we have for answers? We're gonna start with C, 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 and C, renal failure. Very good, you all got that one correct. Okay, now you could have been here already, so you gotta get on here.
Okay.
Command C and Command V, hit
That's not my
enter,
mistake.
and then go and get the answers. So this one's gonna be 1, 2, and 3, so you're gonna have to do it separate, okay? Okay, mild to moderate hypotension secondary to rapid administration of protamine is which of the following types of protamine reactions? Is it type A, type B, or type C?
I didn't know there were types.
Hit enter. Mild to moderate hypotension secondary to rapid administration of protamine is which of the following types of protamine reactions? It's either type A, type B, or type C. And then you can get the next one going.
whatever it is, we need to split our answers.
Bigger?
Okay,
Is it not big enough yet?
and the correct, let me see.
B.
The correct answer is A, Lindsay. So let's do the dice. 5, man, you are not going to be on Lindsay's good list. Oh my goodness.
Okay. Let's see. 1,
Oh my gosh.
2. Oh, that popped back out. That one doesn't want to stay. Okay, not doing that one, I guess.
It's like this.
3, 4, and 5.
Whoa! Oh, Lord have mercy. That patient is struggling, man. This patient is really struggling. All right, here we go. Let's go with the next one. The most common type of anomalous venous return is.
I feel like it's.
Oh, we had that already. We had already done the question. You just needed to do the answers. Yes.
Writing down an answer.
Oh, you did it. Okay. Oh, you're perfect. Is the most common type of anomalous venous return is supracardiac A, cardiac, infracardiac, or just cardiac? Oh, that's,
Okay.
there you go.
Where are the
Can I
answers?
see the, yeah, oh, there.
Okay.
Nancy, you're doing very well today. Nancy Falk is kicking
I
it.
think it's infra, that means below,
I would,
right?
I would say infra. Is that C?
I didn't.
You just say she's doing very well.
They can't see that.
Venous return. It
They
can
can't
be
see her
C.
answers.
I'm going to say C.
Okay. The most common type of anomalous venous return is. Vivian is the only one that got it correct. So I think we should start on this end of the table. Melissa's next.
Okay,
It is your turn to go first.
what is the number?
We're going to find out.
Just get ready. Just get ready.
15. No. 5. You can see it. We show it. So there's no cheating.
I need safety glasses.
This patient is resilient.
Ah! It was resilient. The patient has expired. Okay, so we need a new balloon,
Oh,
and Melissa gets 1 point. Remember, the highest point loses.
oh, highest point loses. That's
Highest point loses.
Oh,
Okay, this is a choking hazard. Please, everybody, be careful.
Wait, who's keeping points?
Magic.
Magic is keeping.
Or no, Maddie. Maddie's keeping point. Maddie is the scorekeeper. Okay. let me
Slip her
get-
some money.
What did I do with the balloons? Oh, there they are. I see them. Okay.
You already had balloons.
Oh, you have
Why
to.
did you need gloves?
Because we're going to run out.
Well, maybe. Well, yeah, we will.
Oh, okay. So we have to do this. So all these come out. It's from China. It takes a bit to put it back together again.
Shouldn't our assistant have the balloons blown away? Shouldn't our assistant blow the balloons now?
Yeah.
The assistant should be the intern? No, Joe's going to.
No.
Oh, your perfusion
Magic.
assistant? Well, where's our perfusion assistant? We should have a perfusion. You're right. I thought
blow
about
up
that. I didn't think
balloons.
about that. You don't want to fill it too much.
Yeah.
Because it pops really easy. There, that's about right.
Oh, you don't even have to tie it.
No.
Oh, it holds it at the bottom.
1. Yeah. Yeah,
You only get a point if it pops?
yeah.
Oh,
If it pops on your turn.
yeah. So, I mean, you can get every question wrong and just not have it pop on you.
Yeah.
Ho, ho, ho.
Let me see. How do I? I'm having a problem here. There it goes. No. There. Perfect. Okay, I got it. All right. Now, they go this way,
They go this way in
this way,
and this way in.
there. Yeah, to one click. Yeah. Okay. This time you get to look at the patient so you can see him as you ruin him. Okay. Here we go. Ready for next? Okay.
I would fail the boards.
Okay.
I would fail
A
the boards.
POTS operation
This
is
so long
an
ago.
anastomosis of A, the ascending aorta to the left pulmonary artery, the descending aorta to the pulmonary artery branch, the subclavian artery to the pulmonary artery branch, or the ascending aorta to the subclavian artery. Those are questions, answers A, B, C, or D. Best answer, please. Now we're going to
This
get
has
off
been
of
so long
this.
ago.
Now we're going to go.
Ascending to the left pulmonary arteries.
Okay.
What are we trying to bypass?
Oh, this is
Ascending aorta to the pulmonary
this one. We're going to start with this
Is there
one.
anything
Okay.
bigger?
Answer, please.
Oh my goodness.
Well,
Gonna
she's.
be 1B.
I don't remember. Let's see, pulmonary artery, descending aorta to the pulmonary
I feel like
artery.
I'm just gonna say A, just so I'm not copying off of you.
I'm
I
gonna
don't
say
know.
D.
Time's up.
Okay, okay.
Okay.
Need an answer.
I don't remember this stuff, sorry.
That doesn't make sense. No.
I don't know what we're bypassing on the POTS, I don't remember.
Sorry.
The correct answer is A, and Lindsay is the only one who got it correct. So let's do our roll. One.
Nice.
Lucky, lucky, lucky.
There you
Okay,
go. Sucker.
all right.
Don't have
Our next
POTS
question.
by us.
The SA nodal branch of the right coronary artery is almost always responsible for the blood supply to the SA node. Oh, I'm sorry. You got to skip that one. Oh, that's fine. You can do it that way. I'm sorry. Which of the following statements is true? So sorry. The SA nodal branch of the RCA is almost always responsible for blood flow to the SA node. B, the major blood supply for the septum is the circumflex artery. C, cardiac venous blood drains either into the coronary sinus or directly into the right atrium. D, medarterioles and arteriovenous anastomosis both circumvent the capillary beds. So it's question, the answer is either A, B, or C. We all know D made no sense at all. It sounded like just, I don't know, Kamala Harris.
Well, it's not C.
Okay.
It's gotta be A, I think. We can't see A and D.
What was A
again.
again?
What was A?
A, oh, you can't see it?
We can just see C and D.
Oh. Oh, we had to put it in 2 comments. So can we repost A? Repost the one that has A. So which of the following statements is true?
Oh, so it can be more than one?
That the SA,
No, it's just the one.
no, it's just one answer.
Okay.
So if you only had A, B, C, or D. So it's really only going to be A, B, or C. The SA nodal branch to the right is almost always responsible for blood flow to the SA node. The major blood supply of the septum is the circumflex artery, or cardiac venous blood drains either into the coronary sinus or directly into the right atrium. Only one of those statements is correct. All of you got it wrong. It is C.
C doesn't make sense.
No,
C was what?
these are board questions. They don't have to make sense.
Even to the coronary sinus.
They do not have to
Oh,
make
yeah.
sense.
Oh, coronary sinus. I thought it said
That
ostium.
does make sense.
Well, you should have been paying better attention. Roll the dice. 3. And everybody gets to participate, so I think we should start with Vivian
I thought he
first.
said ostium.
Vivian, then Mindy, then Melissa, then Lindsay.
Oh,
Ooh, get aggressive.
oops,
Ooh, that can count as her 1.
that's okay.
We'll count that as her 1.
Yeah. 1.
If you don't like your partner, you can shove it in farther.
Did that click?
Pushing.
Did that click?
I think so, yeah.
Yes.
I didn't have to do the 1 because you did 2.
Okay, now we're going to go to a different one. Let's find another one. I don't want that. Got to get out of pediatrics here. This,
There you go, sucker.
Here you go.
I still
Lindsay.
need
Ah.
to do mine,
You got it wrong too.
This is a good one.
unfortunately.
Good thing I
We're going to
don't-
start with,
Now that I saw the C again, I was like,
I thought
that
it said
makes
coronary
sense.
ostium.
I know.
Maybe.
We're
yeah,
gonna
I put
start
that in my,
with-
I put that in my head or something.
Yeah.
'Cause I was like, if
nah.
they went to the coronary ostium,
We're going
that
to
would be
start
enough
with
to
this
do
one.
blood
Which of the
tests.
following is a true statement?
It's been too long to me.
It's too early.
We all good?
Yeah.
Okay, next question. Which of the following is a true statement? The small molecular size of mannitol makes it an effective diuretic. B, reabsorption of sodium and chloride. Oh, stand by. Reabsorption of sodium and chloride in the ascending loop of Henle, proximal tubule and distal tubule is promoted by furosemide. Hypocalcemia is usually a result of endocrine treatment. And D, potassium replacement is usually necessary with the use of Lasix. So it's either A, B, C, or D. Which of the following is a true statement?
I think it's a D.
Yeah.
What's the loop one? Is it Lasix or mannitol?
Loop diuretic.
Which one's the
No.
loop?
I
I'm going
don't
with
think it's
D.
either, right?
10
I'm
seconds.
leaning towards that one.
God.
All of you got it correct? Very good. Okay. Now, we're going to go to the next. Another which of the following statements is not true? Listen carefully. Which of the following statements, or yes, I guess that should say are not true, but that's okay. It's a board question. Which of the following statements is not true of protamine?
Oh.
Which is false about protamine? A, protamine has a shorter half-life than heparin. B, protamine is an inorganic base. C, protamine binds directly to AT3. D, protamine is derived from salmon sperm.
What was it? What's B? Protamine is
It's an organic.
Inorganic base. Oh, so that's, we're doing false?
Yeah, which of the ones is not true?
Oh, doggone it. I can't backwards it. Protamine is a shorter half-life than salmon. Protamine is an inorganic.
We need your answer,
Protamine
please.
binds directly- I don't remember.
We need your answer.
Okay, I know it's salmon. I know it's organic.
Are you sure?
It's salmon sperm. I know that much.
Okay. You all got it correct.
But say which one is correct, because they're gonna listen to podcast, then they.
Oh,
C is the
well,
correct
they can
answer.
see they put the letter up.
But they-
Oh, for podcasts. The answer was, thank you, you are correct. The answer was C, that protamine binds directly to AT3. Or was not true,
Right.
because that's heparin that does
I
that.
can't
Right.
backwards it in my mind.
Okay. Now, which of the following statements is not true regarding heparin?
Okay.
Okay? A, heparin is strongly acidic. B, bovine lung heparin is more antigenic than porcine gut heparin. C, heparin directly inhibits clotting factors 9, 10, 11, and 12. D, heparin directly inhibits the liberation of thromboplastin from circulating platelets. So which of these is not true or false about heparin?
It's not a direct. I don't think
Lung
it's-
heparin is more energetic.
And think about the word it's saying in the words it's using. Because this question is designed clearly to be tricky.
The liberation.
Hygienic. And,
Which one is not true?
yeah, not true.
Indirectly influence liberation.
No, wait.
What are you gonna put?
I put C.
You think?
Oh, this is a good one.
What is it? Isn't there a direct thrombin
Mhm.
inhibitor? Which one? Is that bivalve?
I don't know.
Okay, answer please. And you all got that question correct again.
Again, which is,
Oh,
C.
that's C. The answer is C. I am so sorry. Okay. Vasoconstriction caused by direct alpha-1 agonism would occur with which of the following drugs? A, dobutamine, B, epinephrine, C, phenylephrine, D, norepinephrine. Vasoconstriction caused by direct alpha-1 agonism would occur with which of the following drugs?
I think it's C, but I don't know how other things. So we can have more than one?
The vasoconstriction, you're taking the boards. Vasoconstriction caused by direct alpha-1 agonism would occur with which of the following drugs?
Following drugs.
You get choice A, B, C, or D. Dobutamine, epinephrine, phenylephrine, or norepinephrine. There is no A and C, and there's no D and B. It says A, B, C, or D.
Oh, don't quote me on that. I'm just guessing.
I think I'm just guessing.
Oh, that's a good one. And okay, the answer is C, phenylephrine, and only Mindy got it correct. Three. So we're going to start with Melissa.
Okay.
Oh, that's too easy. Yeah, this is good. No, yeah, it's a good one. You like this one? Okay. Very good. Okay. Next question.
They're still,
We're
they haven't
still-
popped. They gotta do
Oh,
3 people. That didn't go.
No, I know. I think it's gonna pop either way. Oh,
go! Dead, dead, dead. Someday we'll all be dead. Okay.
Oh, we gotta push them through?
Yeah, push them all. I'll get another balloon. Oh, don't knock down my ACT. Okay, so now we have, the points are, what are the points again? We have, Mindy has one and,
I didn't get a
no,
pop.
Oh.
it was just me and
Me.
oh, Melissa. Melissa and,
myself.
Melissa and Vivian each have a point.
Don't be giving me points. I'll get them on my own, trust me.
But the points don't matter.
always pee.
Oh, no.
Oh, that's a little.
It's gonna pop on one.
Okay. Who was the killer that time? You?
Yeah, it was
This,
me.
that's the family.
Do I still need to do my
Oh.
3?
Let me help you. Yeah. Let's everybody grab one. Just here. No,
Oh,
right
wrong
now.
way?
Yeah.
Okay, if you don't know how to do it, then
Didn't just try it
okay.
anyway.
If it doesn't fit, force it. If it breaks, it was meant to be replaced.
I can't pull it back.
Well, too bad. You get
I guess-
you get a penalty on that one.
I still need to do my 3, so that can count
That
as
can count
one
as
of
one of
mine.
One, yeah.
No, that's not how it works.
It did what you
Oh
said.
no. That's no. We're not. No. You ain't getting out that easy. In fact, you get to be next first if anything happens.
You
All right.
have three? I guess you lucked out.
I
What'd we
guess
decide on?
If it popped, I don't have
Ah,
to.
Oh, yeah.
okay.
Yeah.
Last pharmacology
Oh,
question.
thank God.
Which of the following is not a benzodiazepine?
Okay.
Is it A, diazepam, B, Valium, C, midazolam, D, Tracrium, I don't know what that is, or C, or E, Versed.
No.
I don't know if I go with the one I don't know or go with first.
I'm going with the one I don't know.
I'm going with,
No.
I have no idea.
Oh, need to make sure I know the answer. What was the answer up here? That was D.
I've never heard of it.
Okay? You all got it correct.
Yay.
D is the answer.
I've just never heard
That
of
drug that I've never heard of,
Me
don't know
neither.
what it is. Ah, this is a good one right here. Perfect. I like this one right here. Okay, next question. The partial thromboplastin time, PTT, measures the blank portion or portions of the coagulation cascade. The answer is either A, extrinsic,
I always get
B,
this wrong.
intrinsic, C, common, or D, intrinsic and common, or E, extrinsic and common. You have to get E on there.
PTT
You did?
is
You're so good.
longer.
Oh, you typed
so
it?
it has to do the
You're
longer
too smart.
pathway.
So the PTT measures the A, extrinsic, B, intrinsic, C, common, D, intrinsic and common, or E, extrinsic and
So
common.
it has to be A.
B, right?
No, you play it outside.
So you PT outside. You play table tennis because it's PTT
Oh.
inside.
It doesn't do common though, does it?
I don't know if it does. I don't think so.
I think just the.
I think the one after it. That would finish pharmacology.
It's probably.
It's PT
Okay,
or
so
PTT?
let's see our answers.
PTT.
Okay.
Our answer, the correct answer is D, intrinsic and common. So did you, let me see, what'd you get?
No,
I
I
had
started
Oh,
writing
everybody
B.
got it. Oh, everybody got it wrong. Okay. Everybody got it wrong.
6.
6.
Lindsay, go
6.
first.
Ooh. But Lindsay only has to do 5.
Okay.
I was joking about that.
No, I think that's fair.
Okay.
Oh, this is a perfect one. Here it is. This one's next.
I thought PTT played table tennis.
Okay. It goes to
Inside.
Mindy next because Mindy's getting away with everybody else. Yeah.
Wait, Vivian, you're on?
You're next.
She got it
No.
wrong.
I got it wrong.
You're next, and
Oh.
then Vivian, and then Melissa.
Okay.
One.
I'm trying to keep it fair so you don't always get the last.
I am the last. You just said my name.
Yeah, but you
three.
can't do it that way, because if you do it that way, then everybody else, you're always the one that breaks, you're gonna break
No,
the balloon more
no,
frequently.
That one. That's what I mean. I'm gonna.
No, Vivian's last.
Oh, Vivian's
Oh,
last.
You say went Lindsay,
Okay.
Melissa, yeah, see,
Got it.
that's when I, oh, you see? Now you see why I do what I do. Because I knew she needed a point.
Yes.
Oh, I should have gone with that one. That's toward the end.
Uh-huh, okay.
You start doing the balloon, we'll get those.
Yeah.
Yeah, you do that. Okay.
Oh, we're colliding.
I don't know why I had to go. It was her turn.
Perfect.
There you go.
I think I'll learn how to do this before this is over.
Oh, no, she didn't email me my card, but I did it yesterday.
What is it?
My CPR. I don't see that she emailed my card.
Okay.
Remember to tell you guys a funny story about my CPR certification later.
Here? Is it with the same lady?
No, I did it up north. I was with the
Okay.
That I would want to go to that one. That sounds fun.
It was with what?
With the DJ.
Yeah.
Oh.
There we go.
Oh, other way, Vivian.
Perfect.
Oh, other way.
If it doesn't fit, just keep shoving it.
That's right. If it doesn't fit, you must acquit.
I think
Came
that
from where?
one's in the wrong
Oh, Jay
way,
Simpson.
too.
That's right.
Thank you.
Oh, thank
Oh,
you.
nice.
You're gonna lose your putting the peg in privileges here pretty soon.
I don't know which attorney said it.
Okay. Okay. Now we're coming up on the end of this round. In reference to the oxygen supply demand relationship of myocardium, oxygen demand may best be described by TTI, DPTI, LVEDV, or systolic blood pressure. So, in reference to the oxygen supply demand relationship of myocardium, oxygen demand may best be described by A, TTI, B, DPTI, C, LVEDV, or D, systolic blood pressure.
I think C.
I was thinking C, but
I don't even know what T is.
Just tension time index.
what is it?
Tension time index. I think.
Ah,
And then DPTI.
then that could be a TTI. Left ventricular end diastolic volume.
That's a
No,
good one.
I think it still could be C though.
Yeah.
Okay,
feel like it might be
answers?
that, but we'll see.
No.
Lindsay, you are the smart one of the group.
Is it TTI?
It is TTI.
Roll a 1. 1, 1, 1.
2.
All right.
Do I get to go first this time?
It's coming apart.
Yes.
Okay.
You get to go first this time.
Do you see the little peg in
So
the
whoever
bottom?
pops the balloon gets to go first on the next one.
The little peg in the bottom's coming out. I'll show you.
Oh, okay.
What?
One of the pigs is coming out, I think.
The thing, like the little thing that's
Oh,
holding
I
it.
see his leg guy.
His
Came
little
out.
leg
Yeah.
is,
Oh, his leg came off?
yeah.
It's okay. We'll glue that back on.
There we go.
Oh, go ahead and fix the leg. You can do it.
It's gonna push it
It's
all in
gonna-
more.
no.
BKA.
Come
pop
on,
it.
fix the leg.
It's gonna pop it,
It
Joe.
Then
won't.
it's the point.
It won't. Oh, I'll do it. Goodness gracious.
Need a neutral party to.
Oh, there we go.
I know.
Yes. I'm good at it. Okay. Last question in this. Oh, no, it can't be the last. We have to pop one. The therapy for hyperfibrinolysis is the administration of blank, which inhibits fibrinolysis. Is it A, heparin, B, protamine, C, coumarine, D, amicar? So the treatment for hyperfibrinolysis is A, heparin, B, protamine, C, coumarine, or D, amicar. Excellent, Nancy. You are absolutely blowing it up today.
B? What?
No, what am I
I think it can't be.
We're going to do one of these,
A, R,
only we're going to have the
B.
online audience actually be, and we'll have somebody, they get to pick who puts their spikes in.
Is coumadin
So
the same as
there'll be an
coumadin?
online, like an online audience kind of thing. That would be
Coumadin the same
fun.
as coumarin?
That would be competitive.
I think so. Okay, your answers, ladies.
what was the? Yeah.
Hyperfiber.
Okay, we need an answer in 5 seconds, or we roll the dice, and everyone's wrong no matter what.
Okay, crap, I don't know. I think
Give it
it's
your best
actually
shot.
C.
And the answer was D. Everyone got it correct. Good work. Okay, this is good. We'll do that one.
Is coumarin the same as coumadin?
I have no idea. I never heard of coumarine. I've heard of coumaриc, and I've heard of coumadin or
Turmeric.
warfarin,
It's
but turmeric,
Warfarin, yeah.
turmeric,
Yeah.
turmeric, that nutraceutical thing that people use all the time, but I've never heard of
It's
coumarine.
good for inflammation.
Oh, turmeric, not coumaриc,
Yeah.
whatever it's called, I don't know. But I've never heard, no, I've heard of coumadin, warfarin being the same,
Yeah.
one's a generic name and one's the trade name, but I've never heard of that, so I don't know if
If
it's
it's
the
a
same
typo.
thing or not. I just knew I knew it was amicar. That much I knew. I did know that. Okay, this is the relationship between stroke volume and end diastolic volume is expressed by A, the Borelli principle,
No.
B, Murray's law,
C.
C, Starling's law, D, Boyle's law. And please keep your answers to yourselves, Mindy,
I didn't say anything.
or you
bad.
will have a penalty of an independent roll. You are all correct. It is C, Starling's law. Okay. Perfect. Okay, this is good.
I have mics on.
Yes.
Happened
Coagulation is specifically defined as the interaction of RBCs with plasma proteins, platelets with coagulation proteins, RBCs with coagulation proteins, platelets with plasma proteins. A, B, C, or D. Coagulation is specifically defined as the interaction of A, RBCs with plasma proteins, B, platelets with coagulation proteins, C, RBCs with coagulation proteins, or D, platelets with plasma proteins.
B or D.
Nancy says D. Okay, you have the online, our online participant. Okay, you have 5 seconds.
It's either B or D.
5 seconds, or we just roll and it's wrong. You have to put your answer up. Okay, the correct answer is B. Vivian and Mindy got it correct. Lindsay and Melissa are incorrect, as well as Nancy is incorrect on that one. And the number is 4. 4. You can always see it. 4.
Who's
So,
going first?
Lindsay and Melissa?
2, 3.
Oh, this is a good one. I think these 3 are actually good. I like all 3 of them.
There you go.
I like 3. Boom! Okay.
Scream all the time.
Okay, very good. Which of the following is true of type O blood? A, plasma has O antigen. RBCs have A and B antigen.
I don't remember this.
Plasma has no A or B antibodies. D, RBCs have no A or B antibodies. Which of the following is true of type O blood? Plasma has O antigen. RBCs have A and B antigen. Plasma has no A or B antibodies. Or D, RBCs have no A or B antibodies.
This is O neg, right?
It just said O.
Or
Type
just
O
type
blood.
O, okay.
I don't know. I'm just writing down the letter.
Answers, ladies? And the answer is D, RBCs have no A or B antibodies. So it looks like Melissa and Lindsay got that one wrong. Is that
Again.
correct?
Yeah.
Okay. We're keeping track of points, right? Good. 3.
You can go first this time.
Yep. Yeah, only if they get it wrong. Or only if it pops. But you are going to push
Push
it more
that in
the more you
there.
get wrong.
I'm scared of it.
Oh my god.
The stakes are high.
Oh,
I can't believe it didn't go.
you made it that far.
This one's the most resilient one.
Yeah.
I know.
Do it again. I left an inch off the floor every time.
Oh, that one popped back out. Okay.
Oh.
It's stuck.
Whoever gets.
That's fine. She's done, right?
I don't think it popped.
It didn't
No, I
pop.
think it
I
probably-
think one of the
Thing
pegs
came
just
back.
That's
slid
okay.
back.
That's okay. Okay.
Whoever goes next is doomed.
The correct definition of cor pulmonale is A, dual chamber left atrium, B, left ventricular hypertrophy, C, pulmonary hypertension, or D, atretic pulmonary valve. The correct definition of cor pulmonale is A, dual chamber LA, LV hypertrophy, C, pulmonary hypertension, or D, atretic pulmonary valve.
Should I not do that?
Answers? Lindsay is again the smart one of the group. The answer is C, atretic pulmonary valve, pulmonary hypertension. I'm
Oh, I
sorry.
was gonna say, I got
Pulmonary hypertension. Yes, pulmonary hypertension.
Good luck,
Sorry.
y'all.
1-0. 1.
Who goes first?
Who should go first?
You got it wrong?
Oh wait, we'll go by. Who got it wrong last time? Who popped the balloon last?
Me and Lindsay.
Who
Oh,
popped it though?
Lindsay,
Lindsay
did.
did.
Yeah.
Lindsay did. So
no, I
okay.
didn't pop it.
Oh, popped it last.
Who got the last point?
I think it was me, no?
It was.
It was me.
It was you.
Or
No, I think Mindy.
I did. It was Mindy.
It was Mindy got the last point.
I don't know.
Okay, so eeny, meeny, miny, mo.
All right.
It won't be her.
It's only one.
Yeah, one that
Have you
might
seen
pop
this
it.
thing?
Do the one that popped out.
I don't even know which one popped out. Just do this.
Didn't go.
I guess that's the one that popped out because that's the one
Yeah.
that won't stay.
That one won't stay.
Push it harder. There.
There
Okay.
you go.
Oh man. They all look pretty sad.
This is a resilient balloon.
They're all gonna go. It clicked.
Okay.
You got it wrong? You got it right,
Yeah,
didn't you?
I got it
Oh.
wrong. Yeah.
Ooh.
This may be it.
Ooh. Ooh. Just look at him. Look at him. Look at his face. Don't you feel bad for him?
So bad. Death row right here.
You want to give him a sip of Dr. Pepper first?
Diet.
Oh my god.
Oh, okay.
I don't want to get the next one wrong.
Oh!
What?
Point.
I didn't do it.
Who just pushed
Melissa
it in?
did.
Oh, you
Last
did?
one, yeah.
Nice
Melissa
try.
gets a point. Melissa gets a point.
Why are you sad she got a point and happy I got Rude.
She's my favorite. What can I
I
tell
thought that
you?
was men.
Min's not here.
Today's the first time I'm hearing that.
You're number 2.
Okay, y'all pull these out for me.
Yeah.
And then I'll do another balloon. Oh wait, no, that's the end of round 1. We get to take a break. So you can leave that. I'll do it. I'll do this. Okay, so let's take so everybody, let's take a 5-minute break. Everybody can use the restroom, get some coffee, whatever, 5 minutes, 6 minutes, something. Make it 6 minutes, David. And what's our scores before we go?
2.
So let's report the scores.
Vivian has 1 point. Melissa has 2 points, and Mindy has 1 point.
And Lindsay has no points
Correct.
yet. Okay,
Gotten a
when
lot
we come
wrong.
back for round 2, the points are going to be worth 5 each.
Ooh.
5 each, okay?
Got it.
Let's take that break. Is it fun? It's stupid, but it's fun.
This guy,
Ooh, this is a good one.
Nancy is eating it up.
Uh-huh. Ooh, I like
think the
this.
donut shop opens this early. That's the thing. The gas station. Oh, really? Cool.
Ooh, that's strange. Ah. That's very strange. Very strange. I wouldn't have thought that. Oh, this is a good one too. This is a good one. Skipping the pediatric ones. This is a good one. Okay, these are all good. Okay, we're going to start with.
You have a fangirl, Joe.
I'm telling you. Okay.
Peter Foster is really trying to get in touch.
Sir, I stated earlier last night, I sent you another email. Sorry, so long. But I want to explain.
He already commented that.
Hi, Peter. I have not seen my
classic.
Huh?
Okay.
Sorry, Joe.
That's all right.
I don't know if I should send him as a,
Mm-hmm.
That's so cute.
Maddie, can you take the floor and talk?
you got this.
Welcome back.
Okay.
Oh, that's a broken one.
I have.
Oh,
That's,
why
that
do
was
we
so
have?
good,
Was that the one that just
This,
popped?
I think.
and one. And
Did someone ask
That's
if we can do
Let's
board
go
prep?
around.
Yes.
Oh. We are
What's your
clearly
last
failing.
name? Moretto.
No.
Oh, Lindsay.
Robert.
Okay, I thought so. I want to make sure I had the right one.
Okay.
I want to send this to somebody else. Plus.
You saying anything? Just talk. We're live. You can do that. Yeah, tell them what you're into.
Yeah.
What I'm
Cars.
into?
Yes.
Okay.
Tell them about your car collection.
My
Tell them
car
who you
collection.
Whoopsies.
Tell a prospective perfusion program why you want to be with them. That you bring a lot to the table, including the love of cars.
You can roll dice.
Yeah.
That's true. I'm like a professional dice roller as of today. I'm really
But
picking up quick.
You have motorcycles.
That's true.
You're a biker chick.
Yes.
There you
in
go.
the most respectable way.
Very much so. very, very good. Okay, we are now moving into round two. Round two is worth 5 points each.
Bum, bum, bum.
And we have, what do we have up there? Anything?
You're forever.
Nope, not yet.
So let's go with this one first. Okay. First question in this new section. Which vascular network is provided together with its appropriate percentage of cardiac output distribution? Is it that A, bronchial is 10%?
Oh.
Is it B, cerebral is 15%? C, renal is 30%? D, integumentarial skin is 5%, or E, hepatic portal is 20%. So in terms of percentage of cardiac output distribution, is bronchial 10%, is cerebral 15%, is renal 30%, is skin 5%, is hepatic portal 20%. Which of those is the most correct?
No clue.
Okay, answers please. All of you got it wrong. The answer is B. It is that cerebral is 15% of the cardiac output.
Not here.
So all get,
No, it's higher.
all got that one wrong. Okay, let's roll. 2.
Oh, that's not bad.
You're a good roller. You
Melissa goes first because she got it.
uh-huh.
So we get the easy two.
Oh, okay.
Well, we're gonna go with, yes, that'll be first, and then the points is what gauges it next. So it's the one with the lowest points goes after the one who popped, so it goes to Lindsay.
Oh.
Well, Mindy already went.
That's okay. Mindy went out of turn.
Sorry.
I
Give me another
That's
don't
okay.
point
care.
for that.
There we go.
He looks like he's skewed over. So stay away from the bottom.
Ooh, brave, brave, brave. Okay, next. The T wave of an ECG normally represents A, AV node depolarization, B, repolarization of the ventricles, C, repolarization of the left ventricle only, or D, depolarization of the ventricles.
Oh.
So the T wave is AV node depolarization, repolarization of the ventricles, C, repolarization of the LV only, or D, depolarization of the ventricles.
It's repolarization of.
Nancy, I'm sorry, but you got that one wrong. Do you want to know what Nancy answered?
Yes.
Yeah.
Yeah.
I'm not going to tell you.
Dang it. It's a wishful thinking.
Answers, please. And the correct answer is B, repolarization of the ventricles. Everyone got that one right.
I
Okay.
actually even knew that one.
Next question. Which of the following is a clinical diagnosis of cardiac dyskinesia? Which of the following is a clinical diagnosis of cardiac dyskinesia? A decrease in the motion of the affected wall segment. B, a total lack of contraction. C, paradoxical outward movement of the wall segment. Or D, a compensatory increase in the motion of the affected wall segment. Which of the following is a clinical diagnosis, likely an echo, of cardiac dyskinesia? Decrease in the wall motion of an affected segment, total lack of contraction, paradoxical outward movement of the wall segment, or a compensatory increase in the motion of the affected wall segment. And your answers, please.
Wait, total, well, lack, okay.
All of you got it wrong. The answer is C. Paradoxical outward movement of the wall segment would have been the correct answer. Give it a good shake. A good shake. A good shake.
How do
Come
we
on.
get it wrong and everyone has a different answer?
3.
the
Okay.
second time.
So we're gonna
So
go
what-
with who popped the balloon last? But who? You already went from that. So let's go with points. So who has the lowest points gets to go first?
Lindsay.
Lindsay, then
And I'll take
Vivian,
it.
then Mindy, then Melissa.
3.
3?
So you get penalized for already having more points. And you get rewarded for having fewer points. Got to get more answers correct. That's a good one, too.
There we go. Oh. You're already flinching. That's making me scared.
Sorry.
1. Two.
Joe, you look.
He's already blowing up the next one.
Sorry. I'm sorry.
I got one more.
Getting ready.
It won't click.
Push it.
That one
keeps
doesn't
coming
want to
back.
stay.
Push it.
I did.
That one that
Jesus.
that one this whole
Yeah,
time has
it
been
just
giving
keeps
us
coming back.
issues.
Oh,
Yeah.
Okay.
I would go with the other one. I would go with the other one. I would go with the one down below. No, or keep going around.
Yeah,
the
it
one
won't
that she
stay.
says
Well,
it'll
it
go.
won't stay.
It'll stay if you push it.
We pushed
It
it.
won't stay.
She just did it and it stayed.
Oh,
No, that was the other one.
What just popped out? Is it mine?
No idea.
You're good.
Just say no.
Do you like Nancy Reagan? Just say no. Mhm. I know them all. I know them all. In fact, I sell tickets. I'm here all week. 2 drink minimum. Okay, where are we at? Okay, ready. Under. Oh! Who did it last?
Me
Who was-
again.
You again. Oh, 5 points. Oh, my Lord.
This delayed thing is weird.
5 points.
What's
It was
keeping
just-
us awake, that's for sure.
What
That's
happened?
the only reason. It's the
What
only reason
happened?
I'm awake.
Sorry to disappoint you. Was it me?
It is disappointing.
Aw. Who worked with the cardiac surgeon who operated on President Reagan? I worked with the cardiac surgeon who operated on President Reagan. Ben Aaron.
Oh, were you there?
No, I worked with the surgeon.
I mean, so?
He's famous. He's an amazing surgeon too. He is.
Oh, sure.
He is.
Okay.
He trained the surgeon. I
All he
believe.
did was sewed up a little hole.
No, he's a really good surgeon.
I'm sure. But who operated on Bill Clinton?
Dr. Smith.
Correct.
screwed it up, I
Ray
believe.
Smith.
I think
And
he
what
was-
is his claim to fame?
That he messed up. He did
No.
sell the wrong bus.
His claim to fame is what? Off-pump cabbage.
Oh.
Did he do Clinton off-pump?
No.
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 I think so.
Of course not. Because they don't believe in it. It's a gimmick. Okay. What are you laughing at? Are you laughing at my blowing it up technique?
No, no. It was just Mindy had a comment.
What was the comment?
She'll write it.
Yeah, exactly. Okay.
You're pretty rough with those legs.
Lol.
It's inappropriate. Please don't make me have to call HR. I will.
You getting tangled up?
Yeah, we didn't have any of those little clippy things today. Okay. All right. We're ready.
Are we?
I like that one, yes. Most potassium is found in which body compartment? A, intracellular, B, interstitial, C, extracellular, or D, intravascular. Most potassium is found in which body compartment? Actually, which fluid compartment? But it's the board questions. Intracellular, interstitial, extracellular, or intravascular?
Oh.
Our answers, please. Ladies, we need our answer. Vivian got it correct with A, intracellular.
Why are we measured on the outside?
I'm very concerned now. Very concerned. Okay. All right. Let's get it. Let's see.
Oh, we measure.
5. Yes.
Oh,
Okay. Who gets to go first?
oh.
Melissa popped it last, so you get to start. Is that what we're going with?
Yes.
We're doomed on this one.
So it's the who popped it the hot first gets to go first, and then the lowest score gets next, and then the next, and so forth.
Lowest score?
So now it goes to Lindsay.
Okay. It's purely luck.
She just goes for it. She has no flinch or anything.
Well, she probably knows how to play, what's that called? What's that thing called?
Jenga.
Jenga.
That thing.
Jumanji. I figured it's just gonna happen whether I
some
flinch or
point,
not.
yeah.
Do you like that one?
I do.
Is this one that doesn't stay?
Yeah, I believe so.
Melissa got it to stay.
And that's what made it pop.
It'll stay. You just have to push it.
Okay, okay. Okay, 5.
Woo! Okay. The normal stroke volume for an average adult is A, 45 to 55, 70 to 80, 80 to 110, or 0.07 to 0.08. And this is in either The first one, 45 to 55 milliliters, 70 to 80 milliliters per minute, 80 to 110 milliliters, or 0.07 to 0.08
milliliters per
liters.
minute. That's tricky there.
Yes, it is a trick question. I would consider thinking about it.
Well, it's 70 per,
Yeah, we're not gonna do that.
there's only one per minute, right? The rest are not per minute?
Correct.
So if it's.
But remember what the question is. The normal stroke volume for an average adult is just the stroke volume.
Yeah, so it's just ML.
It's A, B, C, or D. Okay. Once the song's over, you have to have your answer. Da 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 da. Nancy, you are correct. Does anybody want to know Nancy's answer?
Yes.
Da 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 da. I will tell you as soon as I am able to get all of your answers. Da 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 da
If it's
da
liters,
da.
then we go to
Okay,
milliliters.
answers or you're wrong.
7, right?
Oh, then it.
Answers or you're wrong.
Wait.
The correct answer is D.
That's what I had.
Lindsay again. Well, then you should have just put it down.
I had it
D
again.
is the correct answer. Good job,
It's
Lindsay.
70 to 80 milliliters.
But not per minute. The stroke
It was-
volume.
It wasn't
Yeah.
per minute. It was just liter.
No, that's 0.07 to 0.08 liters would
So
calculate out for that.
I asked for the calculation here. I'm sorry.
Correct. I'm sorry. I'm sorry. That's the way it goes. You know what?
70 to 80.
You know, I
milliliters.
even tried to give you every hint I
I knew it
could.
was 70 to 80.
Lindsay was the only one. Good job, Lindsay. Let's go.
Well, she can
All right.
convert math.
Give me a 6. Come on, give me a
That's
6.
a beautiful song, by the way.
Was it? Give me a 6.
5.
5. That's still good. That's still
I had
good.
D. You
Okay.
saw D, right?
Who popped it last? Who popped it last?
It's always me.
Oh, well, but you did the last one already. You started already. So who has the lowest score?
Lindsay.
No, but
Vivian.
besides Lindsay. Vivian or Melissa?
Both of them are tied.
They're
we're
tied?
tied.
Okay, but you got the
No,
last
Mindy.
eeny, meeny, miny, mo, so it's your turn. You're
They're
first.
not tied. She's lower.
No, I'm tied
No.
with you.
Oh,
Yep.
okay. 5. Oh, this
5.
is not going to go well. I don't think it clicked.
It clicked.
Did it click? Okay. Oh. The noises are not helping me. Three. I have 2 more.
Boom!
First of all, I had the right answer.
5. Well, you should have left it.
I know.
This is what happens when you cheat.
I didn't cheat. I just
You
had
were
to-
no,
changed
you're
too many
no,
times.
no. Seriously, you cheat. You're not listening to me when I say don't look at the
didn't
other
look.
person's thing. You did.
I just
Cheated. Cheaters never prosper.
I converted.
Converted
I was
wrong.
like, isn't that 0.07? I was like moving the decimal.
Let me
Now
take
I
this
realized,
one.
oh, it was
No
70.
problem.
Hope it pops when you blow it. I can't take any more popping.
Uh-oh. Patient's trying to run away.
Leaving AMA.
I think it's going to be time for
Good something.
this.
Okay, there. Perfect. Yeah.
Patient's a little small.
This one is, yes.
There we go, right there.
I gotta help you guys.
It's a pediatric.
Yes. Leave it right there.
I can't really
Now I
reach.
feel even more.
Now just don't put it in more than one click. So people get some benefit. What time
Other
is
way?
it?
Other way.
6:28.
Oh, okay, we have a little.
We're still in round 2.
Round 2. There. That's it.
There you go.
Perfect. Excellent, excellent, excellent. Okay. All right. Where are we at here? Okay. Well, this is good.
Ugh, he says that every
Really
time.
Okay.
Every time he says that, it hasn't been good.
Yeah.
Activated factor 10
Oh my God.
is the first step in which of the coagulation stages? A, intrinsic, B, common, C, waterfall sequence, D, extrinsic. Intrinsic pathway, common pathway, waterfall sequence, or extrinsic pathway. Activated factor 10 is the first step in which of those stages? Yes, you're welcome, Nancy. That was a good hint.
Who is Nancy? She's doing great.
And our answers, please. The correct answer is B. Melissa got that one wrong.
It doesn't matter. There's no way you're gonna top it on this.
I already gave it 1 click.
2.
Oh, look, that's not even touching. You're good. Do that one. And that one's not touching you.
We're going to do this one next, yes. Okay, all set? All right. Which of the following, this is a poorly crafted question. I'm going to read the question exactly as it's written, and then I'm going to correct the grammar. Which of the following decreased blood viscosity? Which of the following decreases blood viscosity is the question. A, decreasing or decreased blood temperature. B, decreased hematocrit, increased blood temperature. C, decreased blood temperature but increased hematocrit. Or D, increased hematocrit. Which of the following decreases blood viscosity?
There's
A, decreased blood temperature, decreased hematocrit with an increase in blood temperature, decreased blood temperature, increased hematocrit, or just increased hematocrit.
Decrease blood temperature and
Our answers, please.
what it makes it less viscous?
Mhm.
Okay.
Our-
I need to answer the question.
Uh-huh.
I need it on the same page.
Our answers,
Yeah.
please.
Decrease
Show us
blood
your
temperature,
answers.
decrease
And
hematocrit.
Melissa, Mindy, we need an
Increased
answer.
blood
5
temperature.
seconds. 4,
B.
3, 2, 1. B is the correct answer. Good job. Everyone got that right? The correct answer is B, decreased hematocrit with increasing blood temperature. Select the correct statement. The medullary tissue of the kidney is hypotonic relative to arterial blood. The hormone ADH, or antidiuretic hormone, is secreted from the inferior pituitary gland. C, when the ADH level in the blood is high, the kidney produces more urine because the distal convoluted tubule and collecting duct become less permeable to water and less water is reabsorbed. D, erythropoietin is a hormone produced by the kidney and is responsible for increasing red cell production. So you have select the correct statement. Only one of these statements is correct. The medullary tissue of the kidney is hypotonic relative to arterial blood. The hormone ADH, or antidiuretic hormone, is secreted from the inferior pituitary gland. When the ADH level in the blood is high, the kidney produces more urine because the distal convoluted tubule and collecting duct become less permeable to water and less water is reabsorbed. Or D, erythropoietin is a hormone produced by the kidney and is responsible for increasing red blood cell production. Your answers, please. Lindsay got this one wrong. No. Yes.
Yeah.
Sorry.
Okay.
You got it wrong. The correct answer was D. Erythropoietin is a hormone produced by the kidney and is responsible for increasing red cell production. A spin, please. 1.
Oh,
Yes.
Of course.
What?
You're showing favoritism.
Okay. Okay, we're not doing anything with children anymore. Oh, this is a very good one. I like this one. Okay. This one. Which of the following is responsible for the osmotic force in plasma? A, albumin, B, fibrinogen, C, glutatinogen, D, serotonin. Which of the following is responsible for the osmotic force in plasma? A, albumin, B, fibrinogen, C, glutatinogen, or D, serotonin?
Serotonin is something I need right now.
And our answers are? Everyone got that one correct. Which of the following control vascular resistance in the human body? A, arterioles, B, arteries, C, venules, or D, veins? Which of the following control vascular resistance in the human body? Arterioles, arteries, venules, or veins?
Is it arteries or arterioles? Can you have the, there we go. Is it A or B? Can it be AB?
And our answers, please.
I don't know if it's arterioles or arteries.
I think I overthought this question.
I'm overthinking everything.
Yeah.
I'm sure it's
I'm gonna
A,
go with
because I
this.
put,
Vivian is the only one who got it correct. The answer is A, and it is arterioles.
Overthought it.
Okay. 3. So Lindsay has the lowest score still. What were the scores? I need to see the total score. Looks like Lindsay still, she hasn't gotten 1 point yet.
she just is lucky at popping.
So
yeah,
Lindsay, you're
I've just
first.
been lucky.
So you have a 3.
It's 3. Okay.
Mhm. Okay. Next would be Vivian, then Melissa.
I got
Vivian
it
got
correct.
it right.
Oh, you got it. You got it correct. Oh, yeah, that's right. Yes, so the Mindy, and then, yes, and then Melissa.
Wait, I gotta do another one.
Okay.
Okay, and we need 3. Good, that's a double. That was a double. Okay. This is going to be a tricky one.
C.
End diastolic ventricular volume may be A, decreased by decreasing the diameter of arterioles, B, augmented by reducing ventricular compliance, C, decreased by increasing respiratory movements, D, reduced Y venous constriction, C, elevated with the action of skeletal muscle pumps. End diastolic ventricular volume may be A, decreased by decreasing diameter of, decreased by decreasing the diameter of arterioles, augmented by reducing ventricular compliance, decreased by increasing respiratory movements, D, reduced Y venous constriction, E, elevated with the action of the skeletal muscle pumps.
Do you mind going through the question again?
Yes. End diastolic ventricular volume. Can you put the question back up?
Yeah.
Oh. End diastolic ventricular volume may be decreased by decreasing the diameter of arterioles, B, augmented by reducing ventricular compliance, C, decreased by increasing respiratory movements. D, reduced Y venous constriction. E, elevated with the action of the skeletal muscle pump.
Go back to A, B, C. I need to see A, B, C. And maybe decreased. No, augmented by reducing.
And our answers, please.
Go back to A, B, and C, please. Thank you.
Decreased by decreasing the diameter of arterioles, augmented by reducing ventricular.
Yes, Nancy, I'm sorry, but you are incorrect. Does everybody want to know what Nancy's answer was?
No.
You'll find out when you're done.
No, now.
Okay, I need your answers.
I need
ABC.
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 You see D and E?
Augmented by reducing ventricular compliance.
Da 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 da. Da 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 da.
Change
Dot.
my
I think
answer.
you're probably right.
I have no idea. I just went with something.
And the correct answer is E. Elevated with the action of the skeletal muscle pump. And that was an unfortunate question of the process of elimination. All the other things wouldn't have done it, so you got left with that. However, I would have gotten it wrong too. Everyone online got it wrong. Everyone got that one wrong. Likely the board would throw that one out. It was a horrible
Throw
question.
that out.
Okay, we're ready to roll.
Thought the board was throwing it out.
5. 5 is the answer.
5 is the answer. 5.
We're counting this one, even if it was a bad question.
Oh yes, yes.
Okay.
Right down the right
When
down
in
the
doubt,
line.
prove it.
1, 2, 3, 4, 5. No, it goes to Melissa next because she has her. She gets to go next. Yes, I have to. I can't keep picking on Melissa.
You didn't pick on me.
No, I have to not. No, I need you. I really need you. Okay, please don't kill the patient, please. I wouldn't do it from there. I would do it from closer, because it's not going to hurt you. No, I would do it from closer, like because otherwise, when you do it like that, you lose control of it. You're closer like this. Look,
Ugh,
let me help.
Giving her
Why is it
tips
helping?
now.
Yeah,
I don't know what's going on.
so we're gonna go like what I do is this. If you want to close your eyes, you can. But just
Oh, I see.
right
what
here,
you-
like that.
I hope it
One,
stops right when you do it.
and then 2. If you do it from there, you have better control.
Got it. 3. Oof. 5.
Boom.
She didn't even jump.
It's gonna do a delayed one, knowing me.
Mm-hmm.
Well, I think they still have to.
No,
still
Mindy
have
has
to
to
go.
go.
I was waiting for the delayed reaction.
Mindy has to go.
Ugh, they're all like jammed in there.
Hmm.
Sorry, Nikki.
Oh.
One.
Thank you.
Two. Three.
2.5.
4.
Wow.
The pressure's on, the tension. You can cut the tension with a knife.
They're all like jammed in there so far.
It did get quiet in here.
Oh!
You ready to
Oh!
Don't touch it.
We better hurry
Okay.
through this next
Okay.
question.
Okay.
Don't you still?
I think I still have to.
Oh, did
'cause
you
I
get it
think-
wrong?
I think so, yeah.
Oh.
Yeah,
Yeah.
everybody did get it wrong.
Yeah.
Okay.
Oh, poor baby. Okay, here we go.
All right. I'm waiting for it to just. At the
Okay.
I
All
still
right.
Too much.
So this concludes round 2. So 5 points
Yeah.
to
Vivian.
Vivian.
Vivian, are you and Melissa the only ones that have popped it this round?
This round?
Yeah.
I've only popped it just this
Once.
time, I think, yeah.
Yeah.
Is anybody else or no?
Yes. Mindy.
This round, yes.
Yeah.
Okay.
A fiver.
Intern. This is your one job, intern.
I'm feeling all the tension back here.
I have no. Okay, we're gonna take another 5-minute break. Give us 10. Let's take a 10-minute break. Let's take a real break.
I need a
10
tea
minutes.
break.
We'll be right back. Okay. Cool. thing. And it's different than what anybody else does. Okay. This is round 3. The questions now are popping the balloon gives you 10 points. So you can go from winner to loser real quick. Okay.
The last question is.
And you have a
The
chance if
their
you
very
don't pop
last
the
is
balloon
50.
to catch up, so to speak, right? So there you go. All right, first question in this final category. Before we do our final question, the final question will be worth 50 points. Okay, so remember that. The complement system is critical to the mechanism of A, blood gas exchange, B, glucose metabolism, C, inflammation and phagocytosis, D, renal excretion of macroproteins. The complement system is critical to the mechanism of A, blood gas exchange, B, glucose metabolism, C, inflammation and phagocytosis, D, renal excretion of macroproteins. And our answer is, everyone got that correct. Good job. You as well, Nancy. Good work.
And the patient's still alive.
Next, choose the most correct statement.
Oh, I hate these.
The most correct statement. Starling's law of the heart states that over a normal operating range, increasing end diastolic ventricular volume will lead to an increased stroke volume. B, oxygen uptake by organs is dependent on the metabolic rate of the specific tissue. C, for all systemic vascular beds, organs with a high oxygen extraction also receive a high proportion of the cardiac output. D, blood flow to the kidneys is about 20% of cardiac output, whereas heart muscle receives 15% of the cardiac output. So choose the most correct answer. A, Starling's law of the heart says over a normal operating range, increasing end diastolic pressure volume or increasing ventricular volume will lead to an increased stroke volume. B, oxygen uptake by organs is dependent on the metabolic rate of the specific tissue. C, for all systemic vascular beds, organs with a high O2 extraction also receive a high proportion of the cardiac output. Or D, blood flow to the kidneys about 20% of cardiac output, whereas heart muscle receives 15% of the cardiac output. And our answer is
I'm still processing these options.
da 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 da.
I don't know.
Done. Answers,
Going
please.
with my gut.
I don't know.
Lindsay,
Blood flow.
Melissa, I mean Mindy,
Yes,
we
can
have
you
to
go
have
back
an
to
answer.
AB? Go back to AB.
I'm so sorry. You have
Okay.
to put an answer.
Go back to AB is all I need.
You need an. All of you have it incorrect. The correct answer
A.
is A.
I knew it was A. But you wouldn't
Starling's
go
law
back.
of the heart, right?
Dang it.
Until you reach the peak of it. If you remember
then it's
Starling's
like a
curve,
rubber band.
it goes
Yeah.
up, 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 up until you reach too full,
Right.
and then it drops off.
But I didn't know the
Exactly. All right, very good. Let's see.
wording. I needed the wording. You wouldn't put it back up.
5. Okay, whoever has the lowest score, or the highest score, goes first. The lowest score is the highest score. So Melissa gets to go first. Melissa, Mindy, Vivian, Lindsay.
See how Mr. Glove
Alright.
does.
Mr. Glove.
Stay up strong.
Oh, good.
Yeah, think about where they have to go. You don't want them to break if you're in there.
That's true.
Bend over. Oop.
Boom!
Why?
Why? Why not? Why not?
3, 4, 5.
Oh, that's 2. That was
I
3.
did 6 by accident.
That's 6 by accident? That's, oh, that counts towards Lindsay's 1, so you
So
only have
1.
4.
Okay.
That's why I say, oh, be careful. Well, she pushed it extra. That's setting her up for failure. That's the way it works.
There we go.
You're-
There's
Okay.
my 4.
Ouch.
All right? Nobody popped the balloon on that one. Okay, next. Disseminated intravascular coagulation, otherwise known as DIC.
Yeah.
Pulmonary embolism, PE. Cirrhosis of the liver and burns may all increase the amounts of A, tissue plasminogen activator, B, circulating platelets, C, fibrin degradation products, or D, hemostatic action. So disseminated or DIC, PE, cirrhosis of the liver, and burns may all increase the amounts of tissue plasminogen activator, TPA, B, circulating platelets, C, fibrin degradation products, D, hemostatic action. Okay, 5 seconds. 2, 3, 4, and 5. Answers, please.
Oh, no.
The correct answer is C, fibrin degradation products.
Almost put that.
Okay,
1, 1, 1, 1.
5. And we go with the what would be the lowest score first. So I believe that's Lindsay.
Oh, we're just changing it every time.
I do, yes. Mhm. That is game host's privilege.
Three.
Ooh. She has no fear.
That's why I haven't popped it yet.
It senses fear.
Yeah.
Okay.
I can taste the fear coming from y'all. Getting kind of shaped weird.
There we go. 5.
Okay.
Oh, he's doomed.
They all feel tense.
We love this.
No. One more, one more, one more.
This is really gonna pop.
I think the glove might be too strong.
I know. I think the gloves.
Nancy, we are not going to tell them that. We do not want to tell them that.
What?
But it's a good question, a good thing. No, I can't tell you.
Okay.
Game strategy.
What, get the answers right?
Oh, and the patient
I
is
can't.
dead. Dead,
It wasn't as
dead,
bad as the balloon.
dead.
The balloon was louder, I
I
think.
don't know, it still took me out.
That was Melissa. Poor
Once again.
Melissa.
Said that's 10 points.
Mhm.
Is it? Yeah. 10
Yes.
points.
It was a muffled.
It was.
Yeah, it wasn't as
Pop.
I
jarring
thought that
as.
Yeah.
one didn't work. Or does it?
Where did we get another blue one?
It was sitting right there. I wanted to make sure to save at least one for the finale, which after this round is probably going to be what's coming next.
Okay.
So we're doing one more round where they're.
Well, no, this is the final round, and then there'll be the final question that has the most. Fine, that's right. But I know now that I have to put way more air in those. That was way too
Yeah,
way too compliant.
Whoops. There you are.
One more. It's on your side.
Oh, right. There we are.
Perfect. All right. Okay. And I have one more, so there's
Lots
more.
of
Yes. Good. Okay. All right.
Oh, let go.
Okay. We need to get sound. Let's see. Let's
time
see
for me
if
to
I
get
don't
more
have a question.
questions wrong.
Right there.
Good practice.
At the top.
Oh, okay.
Too early.
Are
for
we
this.
ready? Which of the following is or are true regarding the autonomic nervous system? A, as a general rule, stimulation of the adrenergic neurons results in excitation of an organ, such as accelerates the heart rate. B, as a general rule, stimulation of the cholinergic neurons results in excitation of an organ, such as accelerates the heart rate. C, cells which liberate adrenaline-like substances are called adrenergic and are released by cells of the parasympathetic system. D, cells which liberate acetylcholine-like substances are called cholinergic and are released by cells of the sympathetic system. So which of the following is or are true regarding the autonomic nervous system? A, as a general rule, stimulation of the adrenergic neurons results in excitation of an organ. B, as a general rule, stimulation of the cholinergic neurons results in excitation of an organ. Cells which liberate adrenaline-like substances are called adrenergic and are released by cells of the parasympathetic system. And cells which liberate acetylcholine-like substances are called cholinergic and are released by cells of the sympathetic system. Okay, our answers,
So it could be one or multiple, right?
no, it's
Oh, no?
only going to be one answer.
Okay, sorry, my bad.
It's going to be the most correct answer.
Okay.
And our answer is A. As a general rule, stimulation of the adrenergic neurons results in excitation of an organ, vis-a-vis accelerates the heart rate. So D is incorrect. 5 it is.
I should gamble.
So who has the worst score?
Me.
Melissa. Okay, Melissa is first.
Oops. Okay, 5, right?
Mm-hmm.
1,
Oh, this is a really good one. I like it.
4, 5. Who's next?
This one isn't gonna.
It would be, who's got the next highest score?
It's a
They're
tie.
combined, yeah, so Vivian would be first.
Okay.
And then Melissa, and then Mindy, I
Oh.
mean. Vivian first and then Mindy.
You just want me to
Why?
have it.
Why? Why do you say? Why?
Why? Would you
Why?
want me to pocket?
Maybe.
Mm-hmm. I'm on the bottom.
And Lindsay
Favorite
is
one.
Yeah.
next.
There we go.
Am I next or after
You're
Mindy?
now, Lindsay's next.
Wow. That's it. I'm putting on my chaps.
This is totally legit, totally legit.
Uh-huh. You see MC Hammer. Too legit. Too legit to quit. Ugh,
Okay, it's Mindy's turn.
I know.
I'm just
get
doing
so
what I'm
excited
told.
about that, don't you?
I'm,
It didn't pop.
I can't take it. Okay. Yeah.
Boom.
Don't.
3.
That's 4.
Oh, that is
was it?
4, yeah.
That was 4.
Oh, okay.
I'm counting.
5. Don't touch anybody. Nobody touch it. That's 5.
Okay. Here we go.
Don't touch
A
it. Don't touch
base,
it.
I'm not touching that.
a base excess,
Excess, base excess.
which is actually a base deficit of -8. So the board question is written a base excess, but it is a base deficit of -8, accompanied by a physiologically normal PCO2, would most likely indicate which of the following: respiratory acidosis, respiratory alkalosis, metabolic acidosis, or metabolic alkalosis. Correct. You all did excellent on that question. You are correct, Nancy. The correct answer is C. That is pure, unadulterated metabolic acidosis. That was too easy.
I like that one.
more of those.
Are you smarter than a 5th grader? That's what this game is. I'm so glad I'm here and not there. Okay,
That should've
ready
been
for
round
this
one.
now?
I know.
Glomerular filtration is an active transport process. B, will decrease as the protein osmotic pressure of the plasma rises. C, is equal in volume to the volume of urine formation. D, tends to increase circulating potassium levels. Glomerular filtration is an active transport system. B, will decrease as the protein osmotic pressure of the plasma rises. C, is equal in volume to the volume of urine formation. D, tends to increase circulating potassium levels. Correct, Nancy?
Gotta take this.
The red phone? Oh, Lord.
Protein osmotic pressure.
Hi, this is Melissa with HT.
In the volume. The volume of urine.
Everyone gets extra time because the red phone went off.
Yeah,
Oh, good.
fair enough.
So anyway, we're probably going to finish a little early, and I was wondering if I could ask you all, because I think we're going to end early. We're going to end up ending early today. Oh, that was fast.
Yeah.
Was it the case adding on?
No, there's Northwest just saying that it's at 9:30.
Okay, yeah.
We already knew that.
Yeah, it'll be there, yes. And I already told Batya last night I'll get there when I get there.
Okay.
I can't do anything about it. He knew I had this. He asked me if I would do I said I will, but you're going to have to do it at 10 o'clock. They moved it to 9:30. They just have to wait.
What
I'm
was
not
the
worried
answer?
about it.
We don't know yet.
We got extra
Oh,
time. We wanted to
okay.
wait.
Yeah, we got extra time. Okay, you ready? Okay, your answers, please. Okay, and the correct answer is B.
Oh, it is.
Everyone but Melissa got that one correct. So we
She
are
was
going to go.
distracted by the phone.
No, I
So
answered
as
before
we
the phone.
do this, so Mel, I was going to ask you,
trying to
so
help
if
you
y'all
out.
don't mind, I'm doing a thing, like I was supposed to give a lecture between 8 and 9. I think we're going to finish early, and I don't think the lecture is going to take more than 30 minutes or maybe 20 minutes. And it's about basically what does the next 20 years of perfusion look like. And for somebody like me, I am not going to be around. I'm probably not even going to be alive. But for people like Maddie and people like you, Melissa, and you, Vivian, and you, Lindsay,
Thank you.
well, you'll be alive, but you won't still be working, okay?
That's
You're not
not
gonna
a
be still be
poodle,
working. I mean, right?
Yeah.
You're not gonna be working.
No, I'm not gonna be working. I'll win a lot.
I mean, I don't wanna ask how old you are, but I mean, that's very, HR, call HR, you saw that. That's on YouTube's. That will live forever in perpetuity on the YouTubes. Say that again? Oh, great. Oh, great. Oh, that's just wrong at every level. Okay. The correct answer was B, as I said. So, Melissa?
Roll the dice.
Roll the dice. Yes, thank you.
All right.
It's gonna pop.
2. Oh!
You can get away with two.
Oh,
Yeah,
Mel,
two. Two's good.
gentle, Mel, gentle. Do it close and go easy peasy.
I'm not going on another one of these.
1. Ooh. Bottom, 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 to the right, to the right.
Oh.
Yeah. Yes!
Nice, Melissa.
Good work, Melissa.
Don't touch it too much.
Don't touch it, don't touch it. Just don't even move it. Boom!
That's when it always pops for you.
All right. Oh,
the
this
light.
is really good.
Yeah, the
I like
light
this.
heats it and pops it.
Very interesting. That's a tough question. This is going to be a tough question.
C.
It's this one, right? Okay. The greatest increase in insulin levels occurs during which phase of open heart surgery? Pre-bypass, on bypass during hypothermia, on bypass during rewarming, or post-bypass. The greatest increase in insulin levels occurs during, remember, read the question carefully. The greatest increase in insulin levels.
Oh.
It's a trick question because they start making you think glucose. The greatest increase in insulin levels occurs during which phase of open heart surgery? Where would one think that your insulin level would be the highest?
That is a trick question.
It is.
I don't know.
And if you're taking the boards, you got to really read the questions because immediately you think glucose. You're not even thinking insulin.
I even think about it. Like you said.
Same thing, exactly. I would have done the same. I did the same thing because I looked at the answer and I said that can't be. So anyway, our answers, please. Vivian and Melissa got it correct.
Oh.
The answer is C. During rewarming.
I needed this.
During rewarming is when my glucose goes the highest.
Insulin.
Okay. Oh, okay, yeah, I'm backwards again. Don't own it.
I told you,
I know,
I
but I don't
gave you,
listen to
and
what
I
you
even
say.
tried to help you.
I know.
And I still
space
thought
you
of it
out.
backwards.
I don't like backward questions.
Me either.
My
But
mind
that's
doesn't
where the
work that way.
board, that's what they do.
Yeah.
Ready?
Okay, ready.
One.
3.
Who's first? Me? Holy smokies.
Holy smoky.
I didn't even click it.
So sorry. Oh, well, I am so sorry. Okay. We are going to, that is the end of round 3. We are now going to go into final,
Countdown.
yes,
So what are the
final.
What are the points right now?
Okay, we get the points, please.
Drum
Point
roll.
keeper.
Lindsay, you're still at 0. Vivian, you have 5 points.
Okay.
Mindy, you have 16. And Melissa, you have 17.
What?
Okay, we are not touching that stupid thing.
So the final question is going to be, I'll make it, how are we going to make it? So give me those numbers again. So we're going to make it
17, 16, 5, 0.
20.
20.
20
Good
points?
choice, 20.
Okay.
Yeah, good answer.
I get to deduct 5 points for that.
No. No. In fact, we double whatever you roll.
Why are you taking this off again?
Well, I have to
Because
put
he's got another
another-
balloon.
Oh, there's more balloons? I thought there was just one question.
There is. But if everyone gets it wrong, everyone is gonna have to work,
Oh, I see what you mean.
you know, I mean, it's just the way it is.
My brain's
It's
not-
the last, it could end up having to, it depends, right? If we have to
I
have a
don't
whip.
know what's going
We
on.
will have a whip. There will be a
It's
whip.
Lindsay.
Okay.
Just give it to her.
She just has no fear of pushing
I
it
know.
in. She's like,
And the balloon can sense fear.
The balloon senses fear, exactly.
That's why it popped before you even pushed it. It was
Yeah,
the
you
fear.
didn't touch it and the
It
sucker
was the
went.
fear.
I am a little jumpy. I've always been jumpy.
I'm terrified. I'm just good at not showing it.
I have the scream reflex that's annoying.
Oh,
He broke all his legs.
That's all right, I'll get it.
now he is been amputated.
He's an amputee. He has been, yes. That's like that that song. What was that? What's that song by Harvey Danger? They put him in the hospital because he was crazy, and then they cut his legs off, and now he's an amputee. You remember that? You know that
Song
song?
about that?
Yes, it's a good song.
That's such a specific song.
Do you know what song I'm talking about?
No.
No. Went to the hospital with a bunch of legs.
You got it, Joe?
Not really. There.
Wait, one
This
more.
one's still not.
There you are.
Ah, perfect. Thank you.
No
All
problem.
right.
Okay.
We healed his broken legs.
Yes.
I'm going first.
No cheating, Joe.
No, I don't ever
I
cheat.
know, I know.
Not on like somebody at the
I didn't cheat.
Mm-hmm. Cheaters never prosper. Just remember that.
I thought that was number 9.
Mm-hmm.
Nothing.
What'd you say?
Nothing.
No, you said something. Okay.
There we
All right. Okay. Final
Why is he facing
round
me?
of questions.
Like,
He turned
All
us very
right.
specifically.
20 points. Well, it's 20 points. Whoever
Pops it,
pops
yeah.
it, right? Okay.
All right.
Okay.
But no one might pop it, so it's going to take. It could take a while. Okay.
It's true.
Which of the following is the most correct statement? A, for the systemic circulation as a whole, the arterial pressure is determined by the product of cardiac output and the resistance to flow offered by the systemic vascular beds. B, the blood flow through individual vascular networks is directly proportional to the vascular resistance in these networks. C, vascular resistance is largely determined by the large and small artery segments of the vasculature, not by the arteriolar sections of the network. And D, cardiac output is determined by dividing stroke volume by heart rate. Okay? So, which of the following is the most correct? A, for the systemic circulation as a whole, the arterial pressure is determined by the product of the cardiac output and the resistance to flow offered by the systemic vascular beds. B, the blood flow through individual vascular networks is directly proportional to the vascular resistance in these networks. C, vascular resistance is largely determined by the large and small artery segments of the vasculature, not by the arteriolar sections of the network. Or D, cardiac output is determined by dividing stroke volume by heart rate.
Can you flip to AB?
I'm sorry?
Can we flip to the AB?
Yes. Can we flip, please?
I'm flipping.
Yeah.
this one next.
I almost always get done with the reading it and you flip it. Just hold it on A for 1 second, please.
I get through like the
Okay.
slide.
There's too many.
Oh, this is a good one too.
It's A or P.
Oh, this is a good, let's do this one. I'll do this one next. Actually, do this one first. Do this one and then that one. Wait, let me see this one up here. No, let's go to this one.
I think we're all ready.
Okay, we have answers?
Yeah.
Okay, let's go back to the thing.
Oops. Oh, the light's shining.
Which of the following is the correct statement? You got it all, everyone got it correct? Uh-oh. Nancy, you got that one wrong. Sorry. We're going to play this game with the online people being able to roll the
That
dice.
would be
We're going to have
fun.
electronic, can we do that? Can we have an electronic dice? That you just click it and it flips around on the screen or something? Do they make such a thing?
Yeah, we can do it through the app and then check.
Yeah, that'd be fun. Okay, you guys ready?
Yes.
Okay. What is the major determinant of cerebral blood flow? A, PCO2, B, PO2, C, cardiac output, D, aortic pressure.
Oh. maybe I
What
jumped
is
the
the
gun on that.
major determinant of cerebral blood flow? PCO2, PO2, cardiac output, or aortic pressure?
Ooh, it could be the other one.
And our answers are
I might be wrong on this. Could be D too.
the answer is A. Lindsay and Melissa got that one incorrect. So we will roll the dice. 4.
Who's first?
Melissa.
Doesn't really. I don't think it's gonna pop at this point.
4.
Oh, they're conspiring against me over
Yes,
there.
I see that. Why are you helping her and not
You
helping
helped
Lindsay?
Me too.
This one back here.
Why? Why? You don't like Lindsay? Is that what the problem is?
I don't giggle when she has to do it. So there.
There you go.
Okay. Okay. The following arterial blood gas is characteristic of partially compensated metabolic acidosis.
Okay.
The following, so one of these following blood gases, A, B, C, or D, is reflective of or characteristic of partially compensated metabolic acidosis. That's the compensation. Because they're here, they're
Okay.
really.
You write down the question?
It helps me remember things, but can you go through the answers slower, please?
Yes, it's that name.
Thank you.
Okay, now let's think about that is
Yeah.
correct, Michael? Or is that Michelle?
Maybe it's.
Michelle? That is correct. Read the question carefully. The following arterial blood gas is characteristic of a partially compensated metabolic acidosis? So you can eliminate 2 quickly. So the way the question's written, you know you have a metabolic acidosis.
Yeah.
So you're going to want your pH to be relatively normal.
Flip.
And our answers are
Flip. Flip.
Can you go to
Flip.
A and B real quick, please?
A and D,
A and B.
A and B.
Yes, please.
Okay, and our answers are? Everyone except Melissa got it correct. It is the 7.39, yes. So the way the question's written, again, for those of you who are going to be taking your boards anytime soon, it's one of those questions that just messes you up, because it's basically saying, okay, there is a metabolic acidosis, so you know your bicarb can't be 28, that's higher than normal. 23 is normal, so that's the end of those 2. There's 19.5 and 19, those are both low, but the patient in A is going to be tachypnic, and they're going to blow their CO2 off to make their pH come up. So that's how they evolved that answer. So the answer is A. Let's roll the dice. 1.
One?
Do you even need, yeah, you can see it online, it's right there. Good. Okay. The universal blood recipient is which of the following? AB positive, AB negative, O positive, or O negative. Now this is the universal recipient. AB positive, AB negative, O positive, or O negative. And our answers are?
Wait, what?
Everyone but Melissa got that one correct. So if you were AB positive, you could take AB negative, O positive, A positive, A negative. But if you're AB negative, then you can't take anything positive. Very good. Okay. Roll the dice.
2.
Two?
Oh, 2. You're good with 2. They're waiting for me to get it wrong and get a 6.
This is a good one here. Okay. Choose the correct statement. A, heparin levels must be monitored carefully during CPB of a pregnant patient because of the risk of intracranial bleeding in the fetus as the heparin crosses the placenta barrier, crosses the placenta. B, one of the distinct advantages of VV ECMO over VA ECMO is its ability to supply direct cardiac support. C, hydroxyethyl starch has been shown to control interstitial fluid accumulation better than albumin, and it is less expensive. D, bubble point pressure is defined as the pressure change across a filter at which point gas bubbles will pass through the filter. So choose the correct statement. A, heparin levels must be closely monitored during CPB of a pregnant patient because of the risk of intracranial bleeding of the fetus as heparin crosses the placenta. One of the distinct advantages of VV ECMO over VA ECMO, veno-venous, veno-arterial, is its ability to supply direct cardiac support. C, hydroxyethyl starch has been shown to control interstitial fluid accumulation better than albumin, and it is less expensive. Or D, bubble point pressure is defined as the pressure change across a filter at which point gas bubbles will pass through the filter. And Nancy, I'm sorry, that is incorrect.
I don't know.
Okay, our answers, please.
Okay, hold on.
Melissa is the only one that got it correct. The answer is D.
I know that
You want me to get
pregnant
that for
women
you?
have a higher chance
Yeah.
of clotting.
You're the only one that got it
I
right.
didn't know
Yeah.
about heparin passing.
Passing
the
the
placental
Yeah,
barrier.
that's
Okay, ready? 4. And we start with Lindsay.
I'll go last. I know this. I already know this. It already senses my fear.
there you
She
go.
has no fear.
Next.
Yeah, that's good.
Oh,
Hello?
be careful.
Oh. You just went for it.
I would have done that one. I would do that one. Nope. The one down there, left hand, the bottom one. That's the one you want to do. Trust me.
Never trust me.
Closer to the edge. Closer, no, to where the frame is. No, your
like
hand's
hold
right.
it
on.
closer
Oh,
up.
hang on.
Yeah, not so far away, because you're
Oh, well,
okay. Oh!
Did I get one?
Yes, you get to count
Yeah.
one. You get to count one. So that was one. So you need 3.
Two, because I get one.
Nice. Wow.
Don't say wow, that freaks me out.
No, I'm impressed.
Oh!
Stop. It won't stay.
It won't stay.
It won't stay.
Here, I'll do it for her.
No, you won't. You go away.
Give it to me.
No. There. I can't get them to stay.
no, that one.
Did y'all all do
Okay.
it? All y'all did it?
Yeah.
All right. Choose the incorrect or wrong statement.
I can't
Choose
backwards.
the incorrect, meaning wrong statement. A, pulsatile flow has been proved to increase hemolysis, platelet destruction, and coagulopathies.
I don't know.
I firmly believe that. B, the pH stat method requires the PCO2 to be increased during hypothermia in order to maintain a normal pH. C, a decreased pH, acidosis, shifts the oxyhemoglobin curve to the right, resulting in a lower oxygen affinity to hemoglobin at the same partial pressure.
I can't remember.
D, centrifugal pumps will not overpressurize CPB lines because they are both preload and afterload dependent. So you have to choose the incorrect answer. Remember, the one that is wrong.
Okay.
A, pulsatile flow has been proved to increase hemolysis, platelet destruction, and coagulopathies or coagulopathies. The pH stat method requires the PCO2 to be increased. Remember, there's alpha stat and
Yeah.
pH stat,
Which
right?
one's which? Which one's temperature controlled?
Alpha.
pH stat is the one that you're controlling for pH.
Yeah.
So pH stat method requires the PCO2 to be increased during hypothermia in order to maintain a normal pH. A decreased, and you have to think about that. What does hypothermia do to the PCO2? A decreased pH, acidosis, meaning shifts the oxyhemoglobin dissociation curve to the right, resulting in a lower oxygen affinity to hemoglobin at the same partial pressure. Okay? And then D, centrifugal pumps will not overpressurize CPB lines. They are both preload and afterload dependent. Well, I mean, we all have been doing this for a very long time. We know D's not right.
Yeah, so
right?
I need C.
And I think most of us know that B isn't right. So it's really, you got A and C are the only two possible. And Nancy, you are correct in that answer. Michelle, you are incorrect.
What
we have
was C,
two
what was
people
C
online.
again?
That are playing.
The shifting
Oh,
of the
it went
oxy curve.
so fast through C.
Our answers, please.
Whatever.
Melissa is the only one that got that one correct.
What was A? Oh.
The-
I thought it was-
Pulsatile flow has been
flow.
proved. I firmly
thought
believe
laminar
that,
flow
but it has never been proved. Again, you have to listen to the question. Okay? Roll the
That's
dice. 5. Oh my God, okay. Okay, we have to somehow do this fairly. And I don't know how to do this fairly. Each of you that has to do this, pick a number between 1 and 6. Write it down on your board. Do not look at it. Pick a number between 1 and, don't show anybody.
Don't.
Write your own number down between 1 and 6.
What do you think I should do? 2?
Okay? Show me your numbers.
57.
We're gonna make it 2. I'm just kidding. Roll the dice. It'll be whatever the dice comes up. Nope, keep them up.
Oh.
It's 2.
So then what does that mean?
You go first.
Is that
Wait,
good or bad?
keep them up.
Oh. I started
I don't know if it's
erasing
good or
mine.
bad. You go first.
There we go.
3 and you had 4,
I
right?
had 5.
3 and
Okay, roll
5.
them again. Roll it again. So first, we need first, second, and third. 6, nobody. You have to do it again.
Just so I'm closer to it.
Come on, 3.
Why wouldn't it be the one closer?
3 it is.
All right.
Second, third. Okay,
So what's the number? They
5.
It was 5.
It was 5,
2.
yes. It was 5. No, it was
2.
5.
See, at least somebody likes him.
No, we can go back and review the tape.
Oh, is this the one that wouldn't click?
Yeah.
I don't know. I think it's the other one back there that's less.
I don't know actually.
1.
If she gets 5 out of this, I'm going to just be like, I don't believe it.
2. 3. How many do I need?
5.
5. Four. I can't take it.
Boom!
No.
You're coming up here next time, Joe.
5. Step away. Okay.
All right.
Woo.
Okay.
That was tense.
Uh-huh.
Mine's would just go pum, 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 pum.
He's just like, what's this thought about?
You can do it. You can do it. I need a drink.
Do you want alcohol?
Oh, yeah, this is gonna go.
One. Is that the one that won't stay?
Yeah, I think that's the one that won't stick.
How many you have?
I've only got one.
Oh.
Can I just pop it, Joe?
No, just do it. Do it.
It's
Let's go. You might
entirely
not
up
do
to
it.
you.
You might not.
You might not. Just,
Yeah. Well, don't like jab it.
That's 3.
No, that was 2.
That was
It's
3 because
2.
she
It
did
was
2
2.
clicks on one. I heard it.
Oh.
That was 3. Why you hating on? Why you gotta hate on Vivian?
I didn't say anything.
You did.
That's
you were
not-
like,
That was Melissa.
No, it wasn't. It was you.
It was Melissa.
Roll the
Boom!
tapes.
Roll the tapes.
Boom!
Oh,
4.
One more.
Oh my God! I don't believe this. There's
See,
no
we'll
way.
see.
There's no way with this technique of yours.
Yeah, jab it hard.
5.
Oh my God! No, I don't believe it.
Lindsay might
All right,
say-
No
You can pass it to
way.
me, and then if it's in your hands when it happens, it's you.
Oh
Clear the
my
way.
God! Get a close up of that poor patient's face, please.
He's like, oh.
Okay.
He's like,
1. 2.
Why is it so quiet?
3. 4.
my gosh.
There's no way.
There's no way.
5. Oh! Back to red. Oh!
Oh,
Oh!
man.
Oh! Does that go? I need a judge on this because
We did it for me and
Mindy
Melissa.
because Mindy wouldn't take it. She just left it sitting over there.
What?
Should it go to her? Because it had to go back around again.
I wasn't the last one. It was Vivian. And then it would have been Melissa. All right, back to me. Okay, well, I didn't touch it.
Melissa's the only one that got it right.
She got points when it popped after
Lindsay
she
gets
did
the
it.
20. She
Yeah.
gets it.
So did I.
Thanks for fighting.
Okay, are we ready for our scores? Lindsay
think
with
we know.
20, Vivian with 6, Mindy with 16, and Melissa with 17. Our winner is Vivian,
I
is
went
our
from 0 to
winner
20.
today. Good job.
Thank you.
You win a one of the broken
Glove.
balloons.
Glove.
You get a broken balloon. You get the broken balloon award. Okay. Well, that was a lot of fun. I think it was.
Wasn't
Okay.
sure.
So if you guys can spare an extra 20 minutes, and it'll put us maybe 10 minutes over from ending at 8 o'clock. But you know, Bruce Searles was going to give this lecture, which was on the future of perfusion over the next 20 years. And of course, those of you who don't know Bruce is the director of the perfusion program at SUNY, State University of New York. And he works a lot with Hofstra and Ed Delaney. And you know Ed, of course. I love Ed. Ed's a great guy,
That's
right?
great.
Ed is fantastic, and I really do like Ed a lot. And let me go back to this. There's the chat. Yes, we're back on. Sorry, I closed my computer out of habit. Today was great game. That was fun. Thank you, Peter.
Oh, I'm glad
Thank
you guys
you.
enjoyed it.
Peter and all that participated. There. Okay. But you know, obviously, you know, Mindy, you and I, me more so, right? I mean, I'm 68 and a half years old. I mean, I'm not going to work until I'm 80. I don't plan on it. But you know, and of course, I'm a lot closer to the inexorable natural end than anybody else here in this room. But you know, you're a distant second, you know, just in terms of what your natural cycle would be, right? You've been a perfusionist for 25 years,
Longer than that.
30 years,
Almost 29.
29 years. So yeah, I mean, there's so many people that 20 years is a career. 20 years. So you're already 50% almost above that, right?
Yeah.
And so, you know, you're going to have a perspective, and you've watched, I think, Perfusion sort of evolve. Melissa, you're at like 11 years, 10, 11 years, 8 years? 7 years. So you're still pretty early in yours, and you're at like 2 years, 2, 3.
I graduated May of last year, so a little over a year now.
A little over a year. And Lindsay, of course, you know, you got to see maybe a little bit of it before, but as a as a working perfusionist, this is your first year, right? Your
Yeah.
first actual job as a perfusionist.
Yeah.
And so we each are looking at this from a completely different perspective. And then there's you, who's like, I want to be a perfusionist. And so I guess my question would be more to Vivian, Lindsay, and you as to what are your expectations? Like, I think that's the first thing that we kind of have to take into consideration in order to understand what does the next 20 years for you all look like, right? So we could start with you, Lindsay. What's your vision of what your future professional career is going to be like? What are you looking for out of this career?
I don't know. It's a hard question.
It is a hard question, but I mean, do you have a passion for wanting to provide a service that very few people in this country actually can? There's only 4,800
Yeah.
of perfusionists in the entirety of North America, actually. So United States, Canada, and Mexico. That's not a whole hell of a lot, right?
Yeah.
So that's a very, very small fraternity. So it puts you in a very unique category of people. And you ask people ask you what you do for work, and you're like, I'm a perfusionist. And there's going to be very rare occasions when somebody's going to know what that is. They're like, what do you do? What is it? What? That's usually the answer that you get. They have no idea. They thought I made perfume one time. They said, oh, you make perfume? Yeah, sure. I'm a perfuminist, or whatever you want to call it. But so that's something. What else might be in your kind of where your interest is? What are you trying to accomplish in the short term? What's your goal over the next 5 years? Don't say leave HET. That's not an acceptable answer. Okay, just make sure of that.
I mean, right now I'm trying to get more of a mastery on the existing technologies. I know there's going to be evolving technologies even with the new pumps that are out now, some of which I'm still unfamiliar with. So just trying to keep up with things coming out, even though I've just got into the field, and I'm trying to master everything that came before me and everything that's going to keep coming at me.
Is there anything about the job itself, the actual practice of perfusion in a community-based practice, which is, you know, for a community-based practice, we do some pretty good stuff. I mean, we're not, you know, a typical just, you know, blue plate special, 3-vessel cabbages, and maybe the rare occasional valve. We get some good complex cases and deal with a lot of different chaotic situations. We have ECMO, we have angiovac, we have NRP, we have all these different things that we do. Is there anything in particular about the job now that you're working that you weren't expecting, or anything about the job that you're even more happy about than you were before you started?
I think NRP is a really exciting place that perfusion's going. I mean, whenever I left as a perfusion assistant to go to perfusion school, we weren't doing NRP.
That's correct.
And so I came back, and there's this whole new opportunity there. And in school, we obviously had experience with heart transplants and lung transplants, like the actual recipient receiving the organ. But it's very cool that perfusion can now be on the other side of that.
So you
that
enjoy
way.
those cases a
Yeah.
lot.
Yeah.
That's good. So, okay, so do you think, you know, just sort of yes or no, is the actual work that you're doing after having gone through training and all that you did to get through that process alone, is it meeting your expectations
Yeah.
by and large?
Yeah.
Is the time commitment harder than you thought it would be?
I think that's just something you have to adapt to. Every company has different ways of scheduling. I was used to in school, a lot of the time we'd be on call for a whole week at a time. And so then I had to adapt to going back to the structure I was used to, where it's the rotating schedule that we do instead of a whole week at a time.
And you
But-
know, you can always, we are a team, and everyone on this team has a voice.
Yes.
I do my very best to allow for the group to dictate, decide how we're going to do those things. And I hope you would realize, I believe you do, that people are open to those discussions as long as we do it in a way that is inclusive of everyone and
Yeah.
respectful of everyone. But I think those kinds of suggestions are not bad, because we want the job to be as good as it can be for everyone. And that does sometimes mean you don't get all that you want, but you don't get none of you want, or you don't not receive anything or you don't understand what I'm trying to
Yeah.
say. You get what I'm trying to say. Okay, very good. Thank you. That was very thoughtful. Vivian?
I think more research in the various topics of perfusion. There's so many different techniques. Everyone has a different way of doing things. Different centers do things differently too. I think it's interesting to see, as like I've heard once, the different ways to skin a cat. Or there are different ways to skin a cat, basically. So-
Clearly. Clearly. And it's really interesting too. I find it fascinating that, I have very, very strong feelings about a lot of different subjects. And I've said this many, many times. I know that there's evidence-based medicine. I know you can look at studies that are done. There's all kinds of research that gets done. And of course, just because something gets published doesn't mean it's good research. Doesn't mean it theoretically and is reviewed, right, for scientific integrity and scientific vigor and objectivity and all of those kinds of things. But there's any number of papers that are written, that research that's done, that's just junk. But because it gets published, it becomes part of the algorithm of classifying things as either beneficial or not beneficial, and to what degree that may be. So since I know you do a lot of research, and I know that you have a passion for that, I understand, and that you also know a lot about NRP, that you were doing a lot of that as well, if I remember correct. Or
It was more Organox that we did.
the Organox, right?
Right.
So, but you have that. At least you had that information up front from there, which I did not have. Right? I know very little about the Organox. I believe right now they're only for liver.
Yes.
But they're going to move into, I'm sure, the cardiac and renal spaces at some point in time. Right now, Transmedics has the other two. But that's good. So in terms of your job here, what opportunities do you think you're looking for, whether it be here or whether it be somewhere else, you decide to go somewhere else in your future? I mean, I think that's a reality that younger people do tend to do that. I would love for you both to stay in perpetuity, or at least until I die, to be nice, or retire or something. But the reality is that things in people's lives are always going to change. I would say this, that as an employer, I would always want you to leave to go somewhere else, not leave to get away from here, right? That's a very important concept to me, and something that weighs on my mind a lot whenever I think about how this company is working and what it's doing and so forth. So, I mean, I have my own pressures, and that's probably the biggest fear that I have, is that people would leave because they just couldn't stand this job or this company. And so I work very hard to not let that happen. But I guess my question to you is, what are you looking for over the next 5 years to help you have professional satisfaction, professional gratification?
I'm always looking to learn new things. So I like, observing or talking to how other people do things, because something they do may help me and improve what I do as well. I think in the next 5 years, it'd be good to, I guess, see how we can further improve patient care too, whether it be on ECMO or on bypass, because there's all these different things. Like, you got common problems when you're on bypass, glucose is too high, or, what can we do on,
Transfusion rates,
Right, transfusion rate.
ultrafiltration.
what else can we do on ECMO and things like
Yes.
that to help? Because, it's changing and it continues to change, but I think, there's always room for improvement as well.
I agree with that 100%.
So-
Yes. Well, hopefully we will again, we have, Becky's not here, but of course, I think that really good communication
Yeah.
is going to be very helpful for the younger generation, for people that are older like us, because I do try hard to not be stuck in my ways or to not stay narrowly focused on things, but you have to take into consideration an employer has to be very cognizant of case volume, resource utilization, how much income is the company taking in and how much is going out, because obviously I have to run a company and the company has to be solvent or the company doesn't exist. And I tell people this all the time, that if this company were to explode tomorrow, nobody here would be unemployed, right? Because somebody else will just fill the void. The cases are still going to be there, right? And so I have to sort of make sure that I'm meeting these needs, and that's what a company's responsibility is. But from an employer's perspective to an employees, it's really important for you all to tell me what you need, because I have to know. So if I'm not asking the questions, or your supervisor's not asking the right questions, you have to help them understand what it is that drives you, because that's what is going to be focused on with you. Notwithstanding, the cases still have to be done, the call still has to be covered, the ECMO still have to go in, the NRPs still need to be done. All of those things is what allows for the other peripheral things that you may really need or want in your life, whether it be professional or personal. Melissa, you're kind of next on the list in terms of years. Hey, bud, hey, we're good. I'm going to call you back, okay? Don't even worry about this. We're good. I'm positive. I love you. I appreciate you very much. Okay, bye. That was Samir. He was going to join in, but I think we're doing good. Let him sleep. So, Melissa, you're kind of next. What do you think?
The next 5 years.
Yeah, looking at your career. I mean, you basically are now where they've just talked about being the short term, this next 5 years of their career. Well, you're where you are in your career. You've sort of been there, right? Now you're going into yet a different phase. You like to use the term season, right? And that's a reasonable. I like the term actually, but I think that what do you think? And how can you help them? What can you share with them?
One of the things I tell myself is that I'm never done learning. Like every day there's something new to learn, either from another perfusionist or anesthesia team member or the surgeon or the patient themselves. Like, be open to learning from everywhere. So in school, we were so hyper-focused on our part, which is the pump, and our didactics and passing courses. So I didn't really pay attention to a lot of the external things that are happening to facilitate the whole procedure,
Sure.
So after I started working, even the first year or two, I still was just trying to figure out how our team did things. And then I started opening my eyes and, opening my peripheral vision really, and just learning more. And that just keeps growing. There's so much more to learn.
I think so. I
Yeah.
agree with you, but you have to you have to want to.
Right.
Like, no one's going to come to you with a bowl and a spoon and feed it to you. You have to go get it, right? I mean, that's really a harsh reality of medicine. Medicine is very competitive. Even our small little group of cadre of misfits that are perfusionists out around the country, we're all so highly competitive, and it's really important, I think, because I don't know if you agree with this or not, but I would say if you don't believe you are the best perfusionist out there doing a case, you probably ought not do the case. That's kind of how I feel. What do you think?
Yeah, I think you should have confidence
Mhm.
in what you do, but not in a arrogant way. Like,
Right.
still be open to learning.
Yeah, but you
and-
got to have a little bit of
Yeah.
swag.
Yeah.
You got to have
Yeah,
it, right?
confidence, yes.
If you don't have it, I mean, really, that's a problem, right? I mean, seriously.
Yeah.
But you also have to be reasonable in the sense that, I don't know if you agree with this, if all hell's breaking loose, and you know what, I know damn well I don't have enough experience with this, get help.
Yeah.
Would you agree with that as being a fundamental of what we do?
Yeah.
Being able to admit when you are over your head in something.
Yeah.
Yeah, I think so too. You should never be concerned about asking for help. And of course, well, let's go forward with this because I want to address something else. Mindy, tell me, are you optimistic about the future of perfusion,
Yeah.
the next 20 years?
Yeah, otherwise I wouldn't have told one of my children to maybe go into the field.
Mm-hmm.
So yeah, of course I do. I think maybe it will evolve a little bit. Obviously the ECMO thing is increasing. I don't know. I mean, what I've learned so far in my career is what's new is old and what's old is new.
Mm-hmm.
And things just cycle through. And what now is like, ooh, the biggest, newest, cool thing, we did probably 15 years ago. And then they decided not to do it, and now they're doing it again. And like it really cycles.
Mm-hmm.
You know, like the off pump thing, the mid cabs. A lot of those things have changed.
Mhm.
And then, I mean, for a little bit, hemoconcentrator if they have renal insufficiency. Don't use a hemoconcentrator if they have renal insufficiency. I mean, it just keeps. So
Mm-hmm.
I don't know. I would like to see us doing high packs. I love those cases.
Mm-hmm.
They're fun.
Mhm.
They're like NRP. They're kind of chill.
I've done a couple.
Mhm.
I like
They're
them.
not too bad, yeah.
Mm-hmm. Yeah, so you would say that, so from when you first started, the types of cases that you have seen develop, whether it be ECMO, HIPAC, NRP, angiovac, just the various different things that are out there, has a lot changed in 20 years in terms of just the therapeutic modalities that we are providing as a profession?
Well, what's changed is we're getting sicker and sicker patients, and the cath lab is being more aggressive. And sometimes when we get them, they already have 10 stents and no targets, and they're like 90 years old. And I mean, I think our patient population has definitely changed. I think the cath lab changing has affected our profession.
Mm-hmm.
So all the different stents and everything.
Mm-hmm.
What we do, I think, is basically the same. I mean, there might be some tweaks, might be a little bit better of equipment, but sometimes I like the older equipment. I don't like all the bells and whistles.
Mm-hmm.
I like to do it myself.
Mm-hmm.
You know?
Mm-hmm. But if you've never done that, and it's like there's a lot of surgeons, general surgeons, who cannot open a belly because they do it all through endoscopic, laparoscopic, whatever. Yeah, laparoscopic. Right. They can use that robot. They can use all these different, but they can't open the belly.
Mm-hmm.
They've never done it.
Anesthesiologists who can't put a swan in without, using. I mean, they don't
Right.
do things old school and just know how to do it.
Right. Exactly. Yeah. So, but of course that's a function of training, and if that's the direction, then is perfusion at risk of becoming robotic or not? Is it at risk of being automated?
I don't see it
I
in the
don't-
next.
yeah.
No.
50
20
years.
years? No, if
I
it,
don't
yeah,
see it.
more. I don't.
No.
I feel like the field's always pretty adaptable, so whatever changes come, I think the field is quite good at adapting to whatever that changes.
Mm-hmm.
I mean, we're already seeing a lot more like safety devices being implemented on the new pumps, and our role is just shifting to learning how to manage the machine managing the pump instead of just us managing the circuit.
Uh-huh. That's a very good point. And I
So-
think that's a skill. That's the same thing with the laparoscopic versus, or endoscopic, even for vascular surgeons that can't clamp a aorta and put a graft in. They can only do it endoscopically and put a stent in, right? I mean, these are realities that they are facing. They are facing that.
I think
And so I
sometimes-
think Lindsay's point is very well stated.
sometimes common sense has left the building too. Is this pressure real? Does the surgeon ever go, let me feel the aorta? No, that's what they used to do. Hey, just feel the aorta. Do you believe it? They never do that now.
I feel like you have to ask them
Yeah,
to do
yeah.
that.
Can you
I
put
mean,
some of
just-
these comments up? Magic. Magic.
Yes, sir.
Thank you.
Those kind of things. Is the oxygenator working? I don't know, is the blood red?
It's delayed.
I'm sorry. I'm sorry. Yeah, I didn't know if you were seeing them. I apologize. Forgive me. I wasn't trying to be argumentative. You just didn't answer me. If you don't answer, how do I know you heard me? That's kind of like down on the flow. You don't say down on the flow. How do they know you're down on the flow? He ain't gonna make it in the OR. But no, are you my assistant today?
We don't know yet.
Are you my assistant today?
No.
On the second case? Yeah, I think you are. Is he the assistant?
At St. Luke's?
No, the one at Tomball.
Is Magic?
It's either Austin or Magic. Austin's on call.
I want it to be Magic.
Okay.
Magic, do you mind?
Magic, you pop the balloon.
Yeah, okay. I'll take Magic. He'll be my assistant at Tomball. So I
Okay.
have Ashley at Northwest and him at Tomball. That'll work.
Okay.
Okay, so what about, and I want to bring this up to you because Melissa, you're sort of getting this now, and Mindy, of course, I know you've experienced this, but I'm kind of curious about both Vivian and Lindsay, their perspective on this. But if I'm on call, even if I'm not on call, and I get called about something, and it interrupts something that I really, really want to do, though that can be annoying, my perspective on it has been for most of my life is, I have a skill that somebody needs. And that person I don't know, but they obviously need, if we're going to the operating room and going to be doing something or putting somebody on ECMO or whatever it is, they're at a pretty dire moment in their life. And so I don't get upset. I just accept it as part of this. But at the same time, I also realize that we all do have lives. And, I would be lying if I did not admit that one of my biggest regrets in my life is having missed so much of my kids growing up, because I missed almost everything because of work. And that was a personal choice. Yeah. I could have chosen otherwise, but I didn't, and I regret it. But it benefited me in one way, but didn't in another. Now, they're older, and they've long forgiven me, but it's still a regret that I have. And I don't know where that balance is. I went too far to one extreme. So Mindy, because I think you may have this experience maybe a little more, and then Melissa, if you could talk about it a little as well, because I think you've already had that experience and are gaining that appreciation for that reality of our business. What's your career path been like? What's your experience been with that? How do you feel about what I just said?
I did not choose career over children, my family.
Mm-hmm.
I always told Juan, my husband, that I'm a mom first, perfusionist second.
Mm-hmm.
And so I had the advantage of when my children were younger, I was at a community hospital that allowed me to do, I never missed one of their volleyball games, basketball games, hockey games. I mean, I didn't miss it. I made that my priority.
Did Juan?
Yes, he did. He missed a lot of it.
Okay. So, no, I mean, and that's,
Yeah.
look, both of you are perfusionists. That's a very unique circumstance.
Right.
But you both worked at the same place.
Yes.
All right. So,
Yeah.
be that as it may.
I had
that-
the advantage to say, you're going to do the case, I'm going to go see.
Correct.
Yeah.
Right. So, and I don't have any issue with it at all. No issue with that at all. But I think it has to be at least put into perspective, because I think what you said, though I appreciate and respect a great deal, if Juan wasn't in that picture, do you think that would have that it would have played out exactly the same way?
No. But the flip side, there were so many times I brought my mom into the ER because I thought she was having a heart attack. She had ST segment changes. I had to drop the woman off in the ER and say, you're fine, because they called me for an emergency. And I'm like, I'll be back in a little bit. And so there are many times that kind of stuff did happen.
Sure.
And I thought, I have to be there. It's my job. I have to.
Mm-hmm.
I'll be back in a little bit, Mom.
Mm-hmm. Yeah, and we're choosing a career. All of us. We have all chosen a career that, again, you know, it is extremely demanding. There's fewer of us than there are cardiac surgeons in this country. And there's so few people that do what we do. It's not like critical care nursing where you can say, okay, we're going to make that patient a 2-to-1, not a 1-to-2, or 1-to-1. You know, we're going to do this, we're going to do that, we're going to call other people, we're going to call agency, whatever it is. You just can't do that. And then with licensure, of course, I'm very much against licensure for that reason, is that, I mean, the whole point of licensure, I don't want to get off topic here, but the whole point of licensure was simply to try and control the uncontrollable growth of what was then Psycor or Baxter Perfusion, what's now known as specialty care and comprehensive cares, those companies, and that was the whole that's really the intention, the original intent of licensure. Now, since then, it's kind of changed a little bit, but when we had the pandemic with the COVID, you want to talk about having created an awful lot of problems. You couldn't just move resources across lines to manage all of these ECMOs because of the license issue. So everything we do to theoretically protect our industry has an unintended consequence, which can be very negative later on, right? And I think that's something that we need to take into consideration as we move, you guys, especially the younger folks, as you move through your career. Let me turn to you. You aren't one of us yet. It's what you want to do. What the hell made you even decide this is what you want to do? How do you even know what this is? What is your story?
Right, yeah. So, like we talked about previously, I really came across Perfusion on accident. What was that? Is that-
The battery's dead.
That's good.
No. Yeah.
Okay. So I've always been interested in the medical field and knew I wanted to do something, and was prepared to go to med school, take the MCAT, but after I finished all my prereqs, I put it on hold a little bit. I was doing a lot of shadowing at forensic coroner's offices and doing autopsies and things like that. Really enjoyed it, but was kind of unsure how I wanted to move forward. So I waited, did some research, eventually found Perfusion and just wanted to get in touch with the perfusionist, you know, do the whole interview thing, ask questions, do you like your job, what do you do, the whole thing, and that led me to you. So that was kind of my big intro. So I'm really still just scratching the surface, even though this is quite an immersive experience that I've been having. But that's how I came across it, and then the more I learned about it, the more I met the people that have committed, you know, their lives and their careers to this. I was like, this is what I want to do. So
you still feel that way?
Yeah, for sure.
So-
Every day it's like
And you've worked with all of these folks?
Yes, yeah. Yeah, so far I have not shadowed Mindy, but I've been following the rest of you guys around quite a bit.
We
And
keep most people away from her.
yeah. But yeah.
We wait until we wait until you're really established to give you to her.
Yeah.
I miss her.
But as for like, you know, how I see my future, since I am still just scratching the surface, my career pathway feels really wide open still, even though I am choosing this. But all the exposure I'm getting is just kind of honing it all in, and every day I get exposed to new things. And after every day at the hospital, I go home, review my notes, and have to do like a complete software update. And it's just been, you know, it's been a really, really immersive experience that, if anything, every day just kind of keeps checking boxes that I didn't even know existed. So
Good.
Yeah.
Good. You have any questions for these folks?
Well, I have plenty of questions since I'm like still kind of in my application cycle, but I'll save those for later. But it's always fascinating to ask about and hear you guys talk about you know, how you got into it, your work-life balance, what keeps you motivated and keeps you going. And I've been picking up a lot of that info just along the way. But I mean, yeah, every day is still so new to me, and new, you know, all the information is complete new exposure still, but so far I'm really enjoying NRPs have been really fun to sit in on, so I love to kind of pick your brains and stuff. That's very down my alley of interest, so I've been enjoying that a bunch.
Fantastic.
Yeah.
Okay. Well, let me thank you very much for that. I
You're
appreciate
welcome.
it. And you know, I'll ask you this question. Well, yeah, I think you answered it. But do you see? I'll ask it this way.
Okay.
Do you see, in what you've learned about this industry thus far, do you still see from your perspective, a very positive future?
I do, yeah. And the more I see, the more I do feel that way. Because, you know, like Lindsay mentioned, everyone will be having to keep up with technology since it's just moving at, you know, a crazy speed. But also the more I've, you know, gotten to know different perfusionist styles and pick up on little cues, it seems like there are so many decisions that all of you guys are constantly making, you know, behind the scenes. And from what I'm picking up, you're almost predicting things before they're even happening and making your adjustments and making those decisions. So by the time, you know, the patient's info is updated, you know, everything is looking good, but I'm watching you back here, you know, doing all your things. And I don't think that technology is going to be able to take away that kind of finesse that
I agree
you
with
guys
that.
bring to it.
It's an art form.
Yeah,
That's
yeah.
really what it ends up being, I think, is what we do as an art form. And I agree with you. I think that my perspective on this, and I'd be curious what Ed thought, if you ever get a chance to talk with him about it, I'd love for him to participate in something like this. I think he would have some incredibly good perspectives. But I think that our industry, because it's small, has high risk of being grossly understaffed and glutted in very short periods of time. Because it's such a small group, you think about it, a very small percentage, a small number, is a high percentage. When you look at the limited number of people that do this. So you can go from not having enough perfusionists and your work-life balance is essentially non-existent to some new grads not being able to find a job. And that can happen relatively quickly. I think, Mindy, you've experienced that in your career. I certainly have a couple of times, and I consider it like a pendulum. It just sort of goes back and forth. And the farther out it goes, the faster and harder it swings back the other way. And COVID certainly exposed us to an awful lot of inadequate resources. And you see schools popping up everywhere and people getting pumped out, and some of the training is excellent, some of the training is horrible, and you have to be very careful where you go to school because you can be very inadequately trained because they just opened everything up to try and compensate for what happened with COVID. And so now it's very hard to put the toothpaste back in the tube. And so the number of people doing this over the next 4 or 5 years, I think, is going to continue to accelerate, and there will be a glut at some point. That's going to happen. So being established is going to be very important. But my experience in all of these years, and I'll distill it down to just a story, and that is that I would go to work and I would have people, oh, I wish I was a perfusionist. Look at you, you come do your case and you leave. I've heard it all, okay? Oh, you don't ever do anything. You just sit around and just wait for them to call you to go. They gave the heparin, then you come in, you do your case, you tear it down and you leave. You know, that's all you do, you know, whatever. You've heard this before. I don't know if anybody else here has ever heard that before, but the old people who hear it a lot, have heard it a lot. Melissa, you may have. I mean, even doing your career, I'm assuming you've heard that. But then something bad happens, something really bad. And what you find is everyone who wants your job, that says anybody could do your job and how great your job is disappears like cockroaches when the light gets turned on. And you're there all by yourself with the light shining on you and everybody's staring at you because you're the only one that is going to save this person's ass. Or they ain't going to get saved. One or the other. But it's on you. It's you. The very next day, perfusionist, dime a dozen, you won't even have a career until they're 10 years. You know how many times I heard that? I've heard that 4 times. I've heard that I would not have a career in 10 years 4 times now in each 10 years. And it's still going. But it will be up to, in my opinion, all of us. You guys, more than me, you guys as well, but them more than anybody, you next right there, and you to a lesser degree, me to a lesser degree. But I would definitely, if this industry is going to endure, we have to be part of the solution, not part of the problem. There's nothing wrong with trying to make a system work best for you, but how you go about that is extremely important. There are things bigger than us as individuals, and so you have to be willing to embrace things that you have never seen. I can't tell you how much of our business, this company that we have, grew because a different group of people that work for a different company were like, oh, no, we don't know how to do that. We can't do that. We don't do those cases. And somehow I got a telephone call, hey, can you do this? Sure, when do you want to do it? Well, we wanted to do it today, but can you do it tomorrow? Sure, where are you at? And I'll be there. And just go do the case. And that makes you someone that, when you're dependable, when you're responsible, dependable, accountable, because you have to be accountable, that's also very important. If you're those 3 things, you're going to be successful at anything that you do. And when you don't know how to do something, there's nothing wrong with saying I don't know how to do something. There's nothing wrong with that at all. But figure it out, learn. Say, I don't exactly know how to do that, but I can I know some people who know how to do. I can learn how to do that. Embrace the new things. Don't look at it as a burden that I don't want to do that. And be very careful about giving services away. We did that with balloon pumps. Some degree we've done that with ECMO already. Some by necessity. But we did that with cell savers and stuff like that, which some of those things ended up being okay for us to do that with. But if you're not careful, you can definitely get rid of enough of the services, that the additional things that we do, and be pigeonholed into just one thing, and that's going to affect the entire industry, because if you have a glut with all of these other things, you're going to have a super glut, and people are going to basically just not have jobs, and you're going to see salaries plummet. So a lot of the things that we do are essential for us to grow as a profession, continue to grow as a profession. We have seen incredible growth, but you don't want that to become stagnant. There's a saying in business, if your business, and same thing with our profession, I think it translates to the same thing. If you're not growing, you're dying. That's a harsh reality. Cannot stay static. That's a bad place to be, because you're never going to be successful doing that. You'll fail. So you always have to be thinking about growing and balancing it all out. So I know we had a lot of comments online. I'm assuming we were able to put them all up until it isn't routine. Joe, previously, yeah, everyone wants to be a perfusionist until it isn't routine. That is so incredibly true, Nancy. I absolutely agree with you. There's so many great comments. I can't even go through them all. You're welcome to, everyone's welcome to do that, but thank you for all of those. I think we're going to call it a day. And I can tell Bati he can start his case at 9:30 now, so he'll be happy. And you like that? You like that? I'll tell him. Show it to him. Send it to him. Send him an email. Give him a link. Because he can't do it without me. He thinks he thinks, oh, no. I'm never late because you can't do this without me. No. I'm never late because you can't do it without me. I remind him of that every day. Exactly. Okay. Any other comments, questions? Thank you very much. It was a true pleasure.
Thank you.
I'm glad you're here. I'm looking forward to next week, not this weekend, but the following weekend after that.
Yes.
The person that got us together is attending her mom's 50th birthday?
Yeah.
50th birthday party.
Yeah.
And they don't know I'm coming, but I'm going to just be there. So that should be somewhat interesting. I think that'll be a fun little time.
Well, you just
And
told
I
everyone.
want to thank
so-
everyone.
The
Thank
whole world knows now.
Say that again.
You just
You
told
said it on
everyone.
air.
That's fine. She's not watching. She's not watching. She's got a lot more. She's got way busier life than to be watching this.
What if she wants to support Maddie?
Yeah.
She's not.
Aw.
She's not. She loves Maddie, but she's not watching. She's not
It's
watching.
too early
my
for
goodness.
everybody, Joe.
Exactly. Don't show her this video.
I won't.
Okay. I know you won't. Anyway, thank you all very much. This was a lot of fun. And next time, I'll be up there, and somebody else will will play a game with the dice like we did, and somebody else can be there. But I want to do this game. Did you have fun with the game? Was it fun?
Yeah.
Was it high pressure, or was it just fun?
Push of the button.
Just the pushing part.
But was it fun?
Yeah.
Yeah.
You know, yeah. I mean, it certainly reveals that, a lot of this stuff from our basic sciences we kind of forget. But it also, I think, reveals that the board is terrible at how they ask questions. I have to be honest with you, those are some of the worst. These are real. These are really their questions.
Yeah.
So how any of us have ever passed it is beyond me. Of course, when I did it, it was different. But I will tell you, it was very different. We had like little stones and stuff. That was our calculator. And abacus. We had an abacus. That's what we would do. But with that, it was like, the blood is red. If the blood looks like a Marlboro cigarette package, what is the likely PO2?
Juan literally
500.
told me the same exact thing in a case a couple
Well, he
days
would
ago.
know.
Yes, it's true. That's a PO2 of 500.
It definitely made it to my notes.
Yes, and it makes sense, right? It just does. Anyway, thank you, Magic, and thank you, David. Really terrific program today. I appreciate y'all going with this. We did a lot of this on the fly, but I want to do this again and just keep building on this as part of like a program that we do every so often where it's just a game. But have fun with it and come up with different scenarios and things. I think we could make this was kind of a proof of concept. To me, it worked. What do y'all think? Think it worked?
Yeah.
What do you think? Then that's it, unanimous. Thanks, David. Bye, everybody. We'll see you see you tomorrow. What time?
5 in the morning.
We'll see you at 5 in the morning tomorrow. Bye.